Order the 899th meeting of the Board of Directors of MSAD 27. Roll call.
Keith Jandro.
Here.
Isabel Lozier.
Here.
Abby Pooler.
Here.
Toby Jandro.
Here.
Leroy McKenzie.
Here.
Gary Sibley.
Here.
Sarah Ashley.
Here.
Any adjustments to the agenda?
I think the only adjustment we'll have, if it's okay with you, Mr. Chairman, we should move the last agenda item, which is the return to school plan, to occur right after public comment, so that we don't have all, unless these folks want to stay for the entire presentation meeting. That way they can. It's totally up to you.
Now we can move on. Does anyone besides Tanya want to sign up to speak? Okay. Tanya?
All right, ladies and gentlemen of the school board, my name is Tanya Bazin. I reside in Fort Kent. I am a parent of 3 children and a daycare provider for numerous families in this community. I am speaking to you tonight with concerns about the back-to-school recommendations for this fall. The Maine Department of Education, along with the Maine CDC and the US CDC, recommends universal indoor masking for all students, staff, teachers, and visitors to K-12 schools, regardless of vaccination status. Therefore, leaving this decision up to each individual school board as to what is best for returning to school. As a parent, I feel like we know what is best for our child, since we have been making those decisions since the day they were born. This situation shouldn't be any different. Our children have had a normal summer. They've attended summer rec programs, they went swimming at the town pool, and got to visit with family they haven't seen in over a year. They did this all while not wearing a mask. A decision I made as a parent. I felt those activities were all safe to do without one, just like I feel allowing my students to attend school this fall without a mask on is safe. Countless of other parents feel the same as I do, and have organized together so I don't feel so alone with my concerns. Some are here tonight, and others have signed a letter addressing these exact concerns. These letters are all signed by parents, relatives, and guardians of a child who attends school here. So if I can present these to the board, these are all letters that have been signed by members of the community. So I'm not here tonight to discuss the science or data regarding mask wearing. I am here tonight simply because I want to be able to make that choice for my child. By making masks mandatory, it takes away that choice. Each family should be allowed to do what is right, to do their own research, just like they did with the survey the district sent out last week. The district listed 8 sources for parents to read before they answered the survey. There may have been some families who took the time to read each source, and there may have been others who did not. However, that was their choice. They chose what they feel is right for their child. Not for your child, not for the next door neighbor's child, but for their individual child. And that is all I am asking for. I am asking for the school board, please leave the decision in the hands of the parents. Thank you for your time.
Tanya, how many signed letters do you have?
I have roughly 65.
Thank you. Anyone have any questions for Tanya? Okay. Anyone else change their mind, want to speak before we move? Okay. So we'll move on to return to school recommendations.
Yeah. And I apologize, right now we're having technical difficulties, so as soon as we can get the projector going. But for your reference, board members, you do have the slides printed out from our return to school plan. And I'll do my best to try to communicate with the public on what we're talking about until the screen is running. Without a doubt, we have again a year of unknown and uncertainty. Before I present this plan, the biggest difference this year compared to last year is everything last year was done under an executive order by the governor, and the school districts were mandated to follow the return to school, Maine's return to school plan. This year, as Tanya highlighted, everything is recommended by the Maine CDC. There is only one mandate from the US CDC, and that is for mandatory masking on school buses. That is something that is right now not optional. Everything else is recommended with regards to in-school masking. And when we talk about universal masking, you need to understand that we're talking about indoors only. We're not talking about outside. So any mention to universal masking is only inside the school district. That being said, we are committed to ensuring a safe school year as best that we can. We do have Nurse Monique here for you as well as a resource. If you have questions during any part of the presentation, I'm not a health expert. I would defer to people who know more about that side of things. So as I said, we've adopted the US CDC. If you go on the main website last year where you saw all of those guiding documents, now there is a link to the US CDC. And with the exception of that, there is an updated SOP that I passed out to you a few minutes ago. We only received that late last week and then had the opportunity to discuss it as a team. The standard operating procedures for how to respond to things. So we'll get to that through the presentation. So some key takeaways from what the US CDC is saying. Students benefit from in-person learning. You've already supported that by saying our kids need to be in school. We were very lucky last year as compared to most of the country. We had our kids in school for most of the year. We want to capitalize on that and build upon that. They are saying that masks should be worn inside by all individuals who are not fully vaccinated. They are recommending 3 feet of physical distancing between students and schools. They're recommending screen testing, ventilation, hand washing, respiratory etiquette, staying home when you're sick, contact tracing, and quarantining, and some additional layers of safety. People should stay home when they're sick. Elementary schools where students are 12 and under should implement layered prevention strategies, and that's just because they don't have the vaccination at that age. And localities should monitor community transmission, vaccination coverage, screen testing, and occurrence of outbreaks. I think as we reflect on what happened in March of 2020, there was a positive case in the state. The entire state shut down the next day. In learning from that, of course, there was so many unknowns about that, but it was a domino effect. The first school district closed down, and then every school district, essentially closed down within 24 hours. In hindsight, could we have waited longer here in Aroostook County? Probably, but by that time, the governor had issued her executive order and stay-at-home orders, and it is what it is. But we can learn from the past. This year, we do not have the availability of the state's color coordinating system. If you remember last year, they used a system of green, yellow, and red to color coordinate the counties of community spread. Now that is totally being monitored by the US CDC. Not monitored, but being facilitated by the US CDC. And the system we used last year is no longer the same system. So if you go to the US CDC and you type in US CDC community transmission, you are essentially seeing what the US CDC is using as indicators to decide how they're guiding local school districts. For the love of it. Still not working, Henry. Sorry. Just need to select HDMI, and right now it's not. When we presented to the Madawaska School Committee 2 Mondays ago, Aroostook County was in a moderate, so the yellow category. Now they use a low, moderate, substantial, high. Aroostook County was in moderate when we presented to Madawaska. Since then, we have moved to substantial, and in looking at things today, and I provided you a printout of what that is saying today. This is today's printout. If you scroll in, you'll see that we're still in substantial, and on the 7-day moving averages, there are 92.46 cases per 100,000, and I've been made aware that when we get to 100, we move into the high category. What's different in Aroostook County is There's more trees than anything else, so our 10,000 population is spread very, very wide, as opposed to a community block in New York City that might have 10,000 people. So it's a very different look when you're talking about 10,000 people and what that looks like and what that feels like. But that is what the US CDC is using for their determination for low, medium, and high. Right now, as of today, I believe 5 counties in Maine have moved to the high category. So that's where we stand today. So getting to the heart and soul of our plan, we do plan for in-school instruction with no remote option. That was already supported by you last time we met in June. The remote option we found was very tasking on our teachers, not really productive for the majority of learners, and like all other things, people take advantage of different situations. We've learned, the US CDC has learned, kids need to be in school in order to have effective education. So we are proud to offer in-school learning. We still have our 3 models of learning on-site, which is the preferred method. We do have a hybrid in the case that we need it, although we do not prefer the hybrid to any of the models. The hybrid, if you remember, is thinning out our schools a little bit, some kids home, some kids in school. And then we have the remote option in case we have a school outbreak and we have to quarantine X amount of teachers, X amount of bus drivers, and we just don't have enough people to operate the school. Again, we prefer on-site, and our goal is to be on-site at all times. With regards to our hybrid model, we changed it from last year. Last year, we had cohorts A and B. You were in school on one day, or you were remote on a day, and then you flip-flopped the corresponding days. Again, the balance of remote and in-school just really, really hard to manage. So this year, essentially, if we ever have to do a hybrid model, we are proposing in school one day, and then the teachers send homework for you to do at home the following day. It's not connecting behind a screen and trying to tune in with your teacher who's managing students in the classroom. It's in school, or it's working at home following up with whatever your teacher assigned. And then we would also propose that we thin out the grades by having alternate grade levels in school. So on one cohort, it would be pre-K, grade 1, grade 3, grade 5, and so on. And then on the opposite, it would be the evens, K, 2, 4, 6, and so on. Again, as I mentioned, hybrid is our least favorite, so we would not opt to go to hybrid unless absolutely necessary, but avoiding it at all costs. We are making a commitment to intervention and remediation. We know that we have a lot of, for some students who have not been in school consistently for the past 16, 17 months, we have a lot of ground to make up. So our layered intervention strategies are having more opportunities for after-school learning labs. If that is not enough, we can look at some extended day, either morning or afternoon, but right now we're committing through after-school learning labs. We had summer school, and we had quite a good turnout. Mr. Coletta, are you here? Mr. Coletta, how many summer school students did you have this summer?
Right around 50.
50 summer school students for credit recovery. And Mr. Netto?
Around 30.
Around 30. So we did have some summer school programming this summer. We're also going to look at vacation school options. If we have to have a harvest school, we'll try to capitalize on that. Thank you very much. If we have to have a February school, we'll look at that as well. Probably not Christmas break, probably not April break. Those are hard to get people in, but trying to capitalize as much as possible. Thank you. And then we're going to expand our in-school intervention. You've approved a coaching position at Fort Kent Elementary School for an individual to help our teachers build capacity in their classrooms. You've also approved an interventionist here at the middle high school. So building upon those interventions that we can sprinkle throughout the school day. We're going to continue to promote the vaccine, and we're not going to talk about the politics behind that. It's our responsibility as a school to promote vaccination rates. We know that some states are moving into a direction where if they have a certain percentage of vaccinated individuals. They are saying there's no mask mandate. Vermont is one that's looking at that model right now. So Maine maybe could adopt that in the future. You know, if 75% of your students and staff are vaccinated, you're a mask-free school. And if you don't have that, then they're going to recommend. So that's something that we'll keep an eye on. We'll continue to host vaccination clinics. We put out information just a few days ago on an upcoming clinic. If and when vaccinations become available for 5 to 12-year-olds and parents want to sign their children up for that, we'll host that as well. So we'll continue to promote vaccination as best that we can. With the big question of mask use and social distancing, we are going to have to require students wearing masks on school buses. That's because it is a requirement of us by the US CDC. And that's simply because school buses are tight spaces and not very well ventilated, especially here in the winter when we've got to close the windows on the bus because it's negative 10 below. So that's something that we're going to require. With regards to masking, I put option 1 and option 2. Those are not the only 2 options. You have other options as a board. In your, I think the printout I gave you, I had one option, and it was based on the previous plan when we were in a low community spread. Now that we moved to substantial, it's some people question when do we do what. So option 1 is having the optional masking, as was presented to you earlier today. Let parents decide what's best for their kids. Option 2 will be to require it as long as we are in a certain level of community spread, and for this purpose, I said if we move to moderate or low, we don't have to require. But if we're above moderate to low, maybe we do require. That's just some of the options you have. You can, and I'm going to show you some survey data in a little bit here. You can look at treating your middle high school differently than your elementary school. You're the board. You can choose what you want, but of course you have to listen to your constituents as well. We will try our best to maintain a 3-foot distance in all classrooms, and we're going to use stationary or portable plexiglass dividers in classrooms. If masks are going to be optional, we have those. We've already purchased them. We've used them a little bit last year, so that's an option we have to continue to use those in classrooms if we so decide. We're going to have classroom seating plans, and that's just for the purpose of contact tracing. If we have an established seating plan, we can narrow down who has to quarantine versus if we don't. And then we'll adjust our social distancing based on what's happening in our schools. We're going to try to do the 6 foot of physical distancing during lunch, but to be fair, if we're doing only 3 feet during the regular school day, it seems kind of a moot point if we're going with optional masks to do a bigger distance at lunch. There doesn't seem to be an advantage there, with the exception of those students who are choosing to mask, their parents want them to mask up. We're going to have to provide some kind of layered support. And speaking with the administrators, we're going to get very creative with that, have alternate seating here at CHS in the gym versus the CAF. So one will be a 6 foot distance, one will be a 3. And then for Mr. Netto, doing zigzag seating instead of across seating to create more social distance in the cafeteria. Schools will provide face masks to those who want them, and then we'll also allow alternative face coverings for those that cannot wear face masks, like a shield if they have a doctor's note. Same thing as last year. We will be doing the Binax Now as a means of keeping unvaccinated adults at work if the results are negative. So we talked about that a little bit. Binax Now, if we have a teacher that is, or a staff member that's required to quarantine because they're close contact, they're not a vaccinated individual, because that's what they chose, we can have them drive to work in the morning, give them a Binax Now. That's going to be a rapid result within 15 minutes. If they test negative, that means they can come to work in the building and work that day. So they would do that for 10 days during their required quarantine. So we will be doing that. We're also looking at pool testing. At this time, we have not submitted our application for pool testing, and that's simply because we don't have enough information on it. but we received a little bit more when we got the SOP today. If we do have a pool testing program in place, those students who are part of the pool testing program would actually not have to quarantine, as long as they're continue to test negative as part of the pool testing. So it's a little incentive if parents want to, and this is all optional for parents, if they want their kids to be part of pool testing. It's a less invasive swab that they would do once weekly, and those would be sent out, and then the results would come back. They say in 24 hours, but probably like 48 hours because of where we live. And we're just sampling the pool of individuals. If we are to entertain this as a board, I would be recommending that we hire a pool test coordinator. Our nurses have no capacity to take this on above and beyond what they're going to be doing again this year. So that's also food for thought. We're going to continue to ventilate. All of our schools have fans in the window while it's nice. The blue box fans like you see in the front of the room here. We also have air purifiers in every classroom with the DuPont Super Duty, nobody's ever going to get sick filter. We do have air exchange in some areas of the schools. I know in Fort Kent Elementary School it's primarily the B wing, and here it's primarily the cafeteria gym area. So we're using that as best that we can. We're going to do the windows cracked open on the buses while the weather is nice. So we're going to continue to ventilate as best that we can. We will continue to do the hand hygiene, respiratory etiquette, symptom monitoring. That's just good practice. We don't want sick kids in school no matter what the illness. And washing your hands, there's never enough of that because some kids have gross fingers, like some adults. And it's important that we teach that. We spent a lot of money on those temperature monitoring stations. We're going to continue to do that because we don't want a kid with a fever in school anyway. So that's all good practice that we're going to continue to do. We will continue to send home individuals when they're displaying symptoms. That's a requirement that we have to do. And that's not COVID related. That's, sick kids don't belong in school. So, and then sick teachers don't belong in school. So we'll continue to do that. And the nurses will be the boss of that. So don't email or call your superintendent because they're the boss. I'm really not about that. Isolation, quarantine, and contact tracing. What we've learned through this new SOP is that things change if you are a fully masked school, and things change if you are not. If you look at this packet that I gave you, I highlighted a section on page 5, and I believe I can put that up on the big screen as well. This is the new language from the isolation and quarantine. So close contact is defined as 6 feet or more within 15 minutes. That hasn't changed. Close contact, staff or student is vaccinated, and if the exposure occurred more than 14 days after the individual's completion of the vaccine series, if the exposure occurred after the vaccination but prior to the 14 days, the close contact must quarantine. So basically that's saying that even though you've had a shot, you have to have passed that 14-day threshold for either the one shot of J&J or the 2 shots of Pfizer and Moderna. If you are vaccinated, you will not have to quarantine. However, you will have to get a test 3 to 5 days after you are close contact. So that is something that even vaccinated people will have to do. And it is recommending as well that the vaccinated individual wear a mask until their negative test. Number 2, the close contact, staff or student has previous COVID-19 test results. So you've tested for COVID, you've had COVID, you're good for 90 days after you have recovered for COVID. So you will not have to quarantine if you already got COVID and you're within that 90-day window. Number 3, the close contact, staff or student participates in weekly school pool testing, and the exposure was a school exposure. So with regards to pool testing, if you are part of a pool testing program, you will not have to quarantine until your next test, as long as those continue to be negative. You don't have to quarantine. Those are the only ones that are part of that pool testing sample, though. And we must have 30% of our students in a school in order for that to be valid. If we only have 29%, then we can't do pool testing. It has to be 30 or more. Then number 4, if the school has a mandatory masking policy, then the classroom student does not need to quarantine from day-to-day activities, and that's specific to classrooms. So if we have fully masked students, we have a positive individual, the entire class no longer has to quarantine, only the positive student. If we do not have masking, if we have optional masking, there's a good chance the entire class, like last year, will have to quarantine. And that's just because of the nature of what they've learned. So that's just food for thought when you're making your decision. And number 4 is only specific to the classroom. It does not count on the bus or other areas of large gathering. So that's only specific to the classroom. And it does not include adults, it's just students. So that's all information that's part of this equation here. Getting near the end of it here. Last thing for the purpose of the presentation, we're going to continue to clean and disinfect as we've done. We're not going to really do the heavy duty, super like, you know, everyone's cleaning overtime 5 days a week. We've learned enough that, you know, COVID does not live on surfaces. The hand hygiene is the best practice to prevent the spread from surfaces. So if we have an outbreak, if we have a positive individual in a classroom, we'll disinfect that classroom or that area, and we'll do our best to clean high-touch surface areas throughout the day as best that we can. So that's the plan that I have for you. I do want to share with you some survey data, updated as of now. So we've had 685 responses to the survey.
865.
Excuse me, 865.
Where'd you go to school?
I went to Madawaska.
Enough said.
So 865 responses, and that is a variety of Fort Kent Elementary students, CHS, VRMS students, FKES guardians, CHS guardians, our Fort Kent Elementary staff members, our CHS staff members, and then community members at large. So going into each category, we had 140 Fort Kent Elementary students. The red indicates they would like optional, the blue indicates they would like universal, and the yellow indicates they would like CHS to be optional, Fort Kent Elementary to be universal, because vaccines are not available for Fort Kent Elementary students. So you see 75% of the respondents are asking, and this is elementary students, for optional. Moving to high school, middle high school students, it's at 81.1% for optional. And then you see the other categories there, and there was 90 responses for that group. 241 responses from the Fort Kent Elementary parent guardians, and they're at 75.5% optional. We have 175 responses for CHS VRMS parent guardians, almost at 74%. And I know everybody took this survey once, right? Mm-hmm.
I took it 3 times.
I did too. Well, I'm a staff member and I'm a parent, so you know. FKES staff members, 65% looking for optional, but you do have 20% saying that the elementary should and the high school, the elementary should mask up, and then the high school could have optional. So keep that in consideration. And then at the high school staff, 50 responses, 56 saying optional, but another 24% saying that in this building it should be optional. Just at the other building, it should be mandatory. And then your community members at large, 109. You have about 72.5% with options. I shared with you the comments. There are a lot, so you probably went through those and you know, took that with consideration as well. But that's what the survey data says. So I turn it over to you, board members, for discussion, and some of the things I'd like, some of the things that we'd like for guidance as a school is there a time, if you choose to go optional based on what you're seeing, is there a time ever we go full blown? Or do we meet monthly, examine what has happened throughout the month? We come back and share with you what things have been like during the month, and then we go as a month by month, or call an emergency meeting if we feel. So that's all things for you to consider. I know that's a lot.
Ben, the isolation and quarantine and the SOP, is that mandated or?
Nope, everything, the isolation is mandated. So the way we respond to positive cases, it's our public health duty to respond to it using the SOP. Am I right with that, Monique?
Yeah.
So there is no option to the quarantine requirements.
Toby, why don't we go right around the table and everyone,
What Dr. Roberts have to say?
I'll defer to Monique, who got a response from Dr. Roberts.
I have an email from her if you'd like me to read it.
Sure.
When you get it?
This afternoon around 23. Okay. So she said, ahead of the meeting, I wanted to share my thoughts on universal masking in schools. We have done such an incredible job on our school in the St. John Valley. We have not had any outbreaks from within the school, and that's due in large part to following the CDC guidelines throughout this pandemic. The CDC has issued guidance recommending universal masking in schools K through 12. This is in agreement with the American Academy of Pediatrics, and this is especially true in areas of substantial transmission, which Aroostook County currently is in. One thing we know for sure is that the Delta variant is different. We are seeing much higher rates of infections in children, higher hospitalization rates, and higher death rates in children. We know that Delta can be transmitted by those who are vaccinated due to it being 2 times more infectious. St. John Valley has been moving forward with CDC guidance, or in some cases going beyond the guidance this whole time. It would be reasonable to continue to do so. It would be a mistake to opt for no masking. This is not over yet and will likely get worse. I want it to be over too, but it just is not. We need to be strong and show that we take safety above all else, above opinion, above popularity. This is about keeping kids, teachers, and staff safe. Please consider those who have been doing everything in their power to keep their children and themselves safe. Let the schools remain a safe place. Hope you're all well. Allie.
is it true there's no test for the Delta variant? They can't identify the Delta variant itself?
No, so if you go for a swab and you test positive, it then goes for further testing at a different lab. A certain percentage of positive tests the state will pull to determine the percentage of Delta variant causing infection, which right now it's the predominant strain in the United States and in the state of Maine.
Thank you. So, your thoughts?
I'm just a lawyer, not a doctor. I would have liked to have had a conversation with a doctor and had her available to answer. Shouldn't have brought gun. And had her ask questions of her.
And she was asked, and she was not available, unfortunately.
Can she be available?
What's that?
Can she be available?
Well, she's pregnant with her second, due pretty much any time, and is alone with a 1-year-old right now at home. Her husband's away. She would have come had she been able.
Do we have a backup medical professional?
Dr. Roberts has informed us that she is not going to be able to continue as our health advisor. So we've reached out to a new physician at her recommendation, and I'm waiting a response.
From the hospital as well? As I said, I'm a lawyer, not a doctor. I would have liked to have had somebody here to ask questions of. Well, Nick, what do you think?
I got a question. Does she have any children in the school system? No?
She is a
No.
1-year-old and
1-year-old and a newborn? Okay.
Yeah.
What do you think, Nick?
Well, this is how I explain it to my kids and my family. I'm in the medical profession. I don't have my degree in epidemiology or public health or infectious disease, but I know enough based on my work at the hospital to follow their guidance. They're the experts. I might not like it, I might not agree with it, but I've had a Zoom with the vice president of the Maine Academy of Pediatrics. And she strongly agrees with the CDC. She works at Maine Med. She's intubated, taken care of tons of COVID patients, and both her kids are vaccinated, an 18-year-old and a 12-year-old, and she encourages universal masking. The thing with the Delta variant is you can be fully vaccinated, you can be asymptomatic, and you can be replicating the virus, same as somebody who's unvaccinated. They're comparing it to measles and chickenpox, which we know when there's chickenpox in a school, everybody who's unvaccinated gets sent home, and it affects a lot of people. So when you're comparing it that way, and knowing that unknowingly, you're spreading it, and we have a school of 445 students next door who don't have that option to get the vaccine, or students here whose parents don't want them to get that vaccine, it scares me. It really does. And it's like the tornado that touches down in a town. It can take out a whole street and spare the house next door, and you just don't know. You know, people who are smokers and drinkers sometimes are infected seriously, but you can have a healthy athlete who gets COVID and within 48 hours is on a ventilator and ready to die. And the thing with this, at some point, personal choice and the well-being of everybody, making a school safe or making a place safe, you kind of have to have some responsibility to your community. And just the effect that it's going to have on quarantining kids, I mean, that was hard last year to quarantine classrooms and teams. I mean, we quarantined both basketball teams. And we have a lot of kids who sports is everything. So, you know, they come to school and they do their best so that they can play sports. That's their priority. And when you're taking that away, like I briefly pulled up my roster for a soccer team. And if we have a positive case on the soccer team, or they're affected, half my team's not vaccinated. So, yeah, maybe my kid who's vaccinated doesn't have to quarantine, but can you play a game?
Not very well, probably.
Probably not. So, as much as it stinks, I came in here not knowing kids, not knowing their faces, because they've been masked all year, but knowing that it would keep them safe, and to get our country and our state to a point where we have a high enough vaccination rate. It's the hard thing to do, but it's the right thing to do.
Can I ask one question? With all those cases like last year and everything, what were the percentages or what were the numbers of people actually getting the virus in school as opposed to outside of school? Because I know there's community duty, but when kids are doing things outside as opposed, they're actually not bringing it home from school, but it's coming from outside. I just didn't know what those numbers looked like last year.
We didn't have community spread in school.
I think we narrowed it down to maybe one or two.
CDC said probably not.
Okay, thank you.
Can you explain the effectiveness of like a regular mask that everybody typically wears versus the N95? Like how effective is it for my pre-K child to be a student and to wear a regular mask that's not an N95? Expect him not to touch his face. You know, is it worse for him to touch his face, or do you feel he's safer wearing a mask constantly touching his face?
You're safer wearing a mask.
A regular mask,
Yeah.
you know.
N95s,
show.
if you've ever worn a true N95 that's fit tested to your face, is extremely uncomfortable and hard to breathe. Yeah.
So you're saying like everyday fabric mask, the virus will stay inside?
In
The mask?
combination with distancing and masking and hand hygiene, it's like layered effects. So when you put all of those things in place, you're increasing your safety. Like the state of Maine saw a big decrease in influenza rates this past year because we were masking, washing our hands, social distancing. So it is effective.
So we'll talk to Nick. I may come back to it after everybody else has it.
Well, I can say that I fielded several phone calls on this very matter that I forgot was going to happen here today. Yeah, right. I can probably say 99% of those were vying for to be optional. And after talking with my wife as well, I would tend to lean that way myself. Understanding that there's pros and cons to everything. That's where I would be leaning.
Yep.
Well, I guess unlike Leroy, I received one message, phone call. I guess New Canada's a little quieter. I guess I came in leaning more towards optional, just from, you know, things I've seen and read. Obviously, like Toby, I am not a medical professional, so it does make me think a little bit harder when I hear what Dr. Roberts and Minik have had to say. I guess I'm still thinking. I respect, obviously, parents' choice to decide for their children. I'm not a parent, so I haven't had to make those choices for children. I can't imagine how hard it is. Yeah, I guess I'm still thinking on it.
Belle?
Like they said, I'm not a medical professional, but coming in here tonight, I had heard from a lot of parents they wanted the optional choice, and to me that kind of seemed like the better of the two. But after hearing what they had to say, it's kind of like, meh. But at the same time, I feel like if we could also try, maybe, because clearly parents, off of our survey, the parents and community members would much rather see this optional masking. Maybe if we could like try that, kind of see how it works, and then eventually, if we see that it's working, good. If not, then we can kind of make adjustments too.
Obviously, we have a constituency who would prefer the option on whether or not their children are masked or not. I think Monique's input was very valuable. Obviously, we need to have respect for the medical professionals that are out there making these recommendations, but at the same time, we also have to take into account that we live in a rural area and maybe one size doesn't fit all. My concern is especially for the unvaccinated children. We all know, those of us that have had young children in elementary school, those first few years in school, if you're not getting some sort of virus, your kid's not going to school. And for those of you that may have had parents in pre-KK or first, second grade last year, they were going to school masked. Most likely, they didn't transmit anything amongst your family. I know firsthand when my child, the minute they went unmasked on the playground, there was some sort of respiratory virus going around. As a matter of fact, my 13-year-old, we brought him in for testing, tested negative, fortunately. He's now vaccinated, soon to be 14 years old, attends school in this building. My youngest son will be attending 6th grade. He is unvaccinated. He's 11 years old. So my primary concern is that elementary school and how a virus can be so quickly transmitted over there, especially this virus. So I think we need to be especially mindful of that age group. And definitely on the bus. I don't know if we talked to the bus drivers, but the projectile vomiting that takes place on occasion, I imagine that's been down greatly over the past couple of years.
Or Peter.
He's not around. I don't see Benny either.
So.
That's my take on it. I really think the elementary school we should consider masking. Middle school, high school, optional. So.
Ben, how often is this updated, the status of stuff?
I have a daily reminder to check it, and so I check it every day. And it's always on a 7-day average, so it's updated daily on a 7-day average.
And this document, the only date I see in it is referencing updated July 9 from the takeaways for the CDC recommending not fully vaccinated, but it sounds like, are they now, CDC is recommending, and the DOE is recommending
The guidance,
universal?
which was updated on August 5, Bullet point number 3, key takeaways: due to the circulating and highly contagious Delta variant, CDC recommends universal indoor masking by all students, staff, teachers, and visitors to K through 12 regardless of vaccination status.
And the DOE, I feel like there was something somewhere
The DOE follows that.
follows that.
Yep. Initially this summer, the suggestion was for masking for unvaccinated. And when we met in July, we had talked about that, and then days after our meeting, the new guidelines came out.
So that's what Monique just read to you, and the date on that is August 5. So your slide is, my slide is outdated. And this is the comment she just read.
I guess, similarly to last year, I think it makes sense for it to be a fluid thing. I think it makes sense for it to be, follow some sort of something. I mean, last year we went with the green, yellow, red. I mean, none of us are medical professionals. That's what we have you for. That's what we have Dr. Roberts for. I can't think of, like, when do we ever as a board go against what somebody's recommending? Like, the DOE says we recommend this.
Well,
We
we have to separate our wants from our needs and come up with a compromise between the two.
I guess I don't feel qualified to differ from the CDC and DOE on something health-related. And I know one of the big things, right, is kids missing out on school. We're still recovering from that. We still have multi-layered, remediation and optional. Sounds like a lot of quarantining and a lot for our admin to try to shuffle and move, find coverage, find lunch space, find all of that. It just seems like a lot of moving parts constantly all the time, and it seems like masking would give a break from some of that, where
With universal masking, if you have a positive student in a class, your unvaccinated students can still attend class. They still would have to quarantine on the outside, but they could still attend class. So universal masking keeps the most kids in school. We're already hearing about positive cases in the community in Madawaska. It's not if we start quarantining, it's just a matter of when.
now the CDC and the DOE's recommendation about universal masking, is that tied to this high, substantial, moderate, low, or is it regardless? I think that's where that's where maybe there's opportunity for.
But when we quarantined and all that last year, we had our own tracker for the St. John Valley, correct? Northern Maine Medical Center tracked cases, the university tracked cases, and we went off those numbers.
Right.
Not what is happening down in Holton is a lot different that happens up in Fort Kent.
And I don't know that information is readily available at
Right,
this
so there are
time.
no more,
Fortunately,
there are no more trackers on Fish River Rural Health, Northern Maine Medical Center. There's no, and I'm showing you the map of the US CDC, so you'll see that the majority of the country is in high community spread. For us, the only tool I have to use is to click on Aroostook County, and it brings me to Aroostook County as an entire entity. Now, for preparation for tonight, I did reach out to Fish River Rural Health, and I did reach out to Northern Maine Medical Center. And the questions I asked: in the last 7 days, how many positive tests have you received at your facilities? Have you treated anyone for symptoms in the last 7 days, and has anyone been admitted to the hospital? For Fish River Rural Health, they have had 0 positive cases in the last 7 days. They do have 2 confirmed cases prior to the 7 days that are still in isolation. and obviously they don't admit people. But Heather at Fish River Rural Health did mention that they are staying in what they call phase 1 at their clinic, which is the most comprehensive phase, and they're not relaxing to phase 2 or phase 3 at this time because they're seeing an uptick in what's going on. And then for Northern Maine Medical Center, they've had 3 positives in the past 7 days, 2 with mild symptoms, 1 that was asymptomatic. Nobody has been admitted to the hospital. But they did say that they have received numerous calls today about positive individuals that tested themselves or went to Walgreens. So they're waiting to see if those people go in for a PCR test.
And the numbers that we saw reported last year from the hospital, from Fish River, those numbers that you were seeing were accurate to a point, but they were only PCR results. You didn't see all the positive antigen tests from Walgreens or other areas that did the rapid testing. So what everybody kind of based their numbers on, whether it was like 100 people or 150 in the community, you could probably multiply that by 3.
Probably.
Most likely. There were lots of positive antigen tests through Walgreens.
Which is fine, but you need to look at the severity of the cases. You can say there's 100 cases and 1 person was severely ill. Are we gonna shut everything down for that?
Well,
No,
We need
but
to
we might
look at the-
quarantine it. We might have to
In
quarantine
the
the whole school.
quarantining, we were way overboard on quarantining.
But you
So
can't do
should
it
we
again.
not do quarantining either?
We have,
I'll get around to my talk here.
Well, go ahead, I wanna hear it, Gary.
You know, you have to also ask yourself, what's the severity, like, after having him in February, I still get I still get the headache, I still, like, get brain fog from it. I never was, like, I never had any respiratory issues or whatever. But it's not fun. God, it would absolutely devastate me if I knew one of my students or any child got COVID, especially the variant.
But they got it even wearing masks all the time.
But they didn't get it
I
in
know.
school.
And they didn't get it in school. So we have to come up with I don't know.
Like Sarah said,
The
going
only,
with,
the only way we're gonna know if this is successful or not is if we try. We have, the community spoke, I mean, if you give it a try and see how the cases go, you know, that's step 1.
I think we're only gonna know it's unsuccessful
Right.
if we try. There's a difference, right? We're only gonna know if what we're trying is unsuccessful. We can't know it's gonna be successful.
The
We
virus,
only
It
know
doesn't
if the kids
spread.
get sick.
It
Right.
doesn't spread.
So it's only if it fails that we know.
right,
If we err on the side of caution, then we'll never know if it worked or not. Because theoretically, nobody's gonna get sick. So I think that's what I'm struggling with, is I'm wondering how much I'm willing to bet on my feelings versus what I'm being told by people who are in the medical community. And I hear you, freaking hate wearing it, okay?
Yeah.
I'm vaccinated, I'm like Keith, I got a split. I got 1 kid that's vaccinated, and I got 1 kid with medical issues. And I don't know what happens if she gets sick. And, like, not to make it personal, but it's kind of personal, I'm really worried about that. At the same time, like, I get it, but
But that's why it's optional. Your kid can wear a mask.
my kid will get sick if your kid's sick.
But he's wearing a mask.
Will they get sick if his kid gets
If
sick?
the masks work and your kid is wearing a
If her
mask,
kid is sick, her kid will be
wearing
home.
a mask.
send my kid home.
We heard the sports
Let's
analogy.
ask
What
it.
about the social piece? What about those kids that don't play sports, but the social piece is everything to them, and that's really the biggest piece of their day. Those kids that socially need to see other people, that need to be able to socially be around people, see their faces. The kids that rely on facial expressions because they don't understand the words. You know, and I know that we use a sports analogy, and that's great, but there are those kids that need that too. And that's where my heart starts to break. These kids sometimes rely on those things. That expression is where they get the good feeling or the bad feeling or the yes or the no. And we can't forget those kids either.
I think the medical community recognizes mental health as big as a player as physical health. And I think we need to consider that too.
So Nick, there was something that was brought up, I'd like you to address it. If we have an optional mask, if my kid wears a mask and folks who generally don't believe in masking or vaccination, I'm assuming that people aren't gonna mask, right? Does that mean if my kid wears a mask, she's safe?
Not as safe as if everybody was wearing masks.
Why is that?
Because you're gonna have a lot of potential virus particles floating around in the air, whereas if the person who is infected has the mask on, it's much more contained.
And what if
And
they're
if they're
socially
coughing
distant?
or coughing. If they're coughing or talking or eating,
She just asked a question, what about social distance? Does that
Social-
help with the, what one doesn't have a mask?
social distance helps,
Mhm.
but it helps with all of those strategies together. It's like Swiss cheese. If you keep adding more mitigation strategies, you get cheddar cheese instead of Swiss cheese with holes in it.
So I have a question. What comes with universal masking? So if we look at last year as an example, you know, the kids got out, I don't know, an hour and a half early or whatever it was every day. We got out of school if it was too hot because the kids were masked and that was a risk. What comes with universal masking? If I look at some of the cases last year and some of the kids that got it in the school systems, they got it outside of school. So if my kid goes to school all day, every day in a mask, and you find out, you do tracing, you find out that they didn't get it in school, that they got it outside of school and they were involved with all of these other kids. Even though those other kids were masked all day in school, they're still gonna have to stay home, right?
If they were close contacts.
So when we talk about keeping kids in school, is this really the option? When will my kid get the most time in school?
With universal masking, less kids will be sent home.
But if you
Quarantine.
compare it to last year,
We can't really compare it. It's gonna be a bit different this year because of the Delta variant. But
Even if they
we
got it out in the
have-
community?
We have vaccines on board for a lot of people right now, so that does make a difference with the amounts that we will have to.
so does our school schedule change
Ben, why don't you
if we
answer?
do universal masking?
Sorry, what's the question?
Does our school schedule change?
Are we looking at an abridged schedule if we do universal masking for everyone, like we did last year?
We have not discussed any change in the school schedule, whether we're universal masking or not.
Because we're not looking at masking outdoor. Whereas last year, it was literally all day. But there is no recommendation regarding outdoor use of masks. It is for indoor use only. So they will have times during the day when they won't be masked, if that helps, Darcy.
No, that answers the question, thank you.
You're welcome.
Minnick, if they were at a table and they had the partition up without a mask on while working, would that be okay? But if they like got up to, I don't know, go to the bathroom or whatever and then put on their mask, would that be okay? Like, even me, if I wanted to go and work with them one-on-one and I put on my mask and, but then when I was teaching or reading a story and they're sitting, 3 feet apart,
It's not as effective. I keep thinking back to them comparing it to chickenpox and measles.
that's what's
It's
very,
just-
variant is aggressive.
It's not the same COVID that was affecting everybody last year.
I just
But
wanted to ask.
At this point, this year, there are different diagnoses for, medical diagnoses that allow kids to have IEPs, individual education plans. Long haul COVID is now one of those.
Yeah.
Because of the effects it's having on people, long term.
And the mitigation value of the plexiglass dividers
Yeah.
is nowhere near what the mitigation value of a mask is. It's just it's one of the multi-layered approach to mitigation.
Even like Amazon masks?
Yes.
You, sir?
Yes,
Yes.
for now.
So, not to discredit the medical field, CDC, or anything like that, But I think we have to use common sense in this, and we have to look at the communities that we live in. And I have a hard time to give the CDC a great deal of credibility when we have a southern border that's wide open. If this is so serious, that border will be shut down. Instead, we're busing people, we're flying people all over the country. But yet we're telling our children, communities, schools, whatever, you have to do this, you have to do that. If it's so serious, why don't they shut the southern border? They have diminished credibility with me because of that. We have 16 school districts in Aroostook County. 13 of them so far voted to be optional. 2 are mandatory masks. We're the 16th one to vote.
And one of them is calling an emergency meeting on Wednesday to talk about their decision. I just want to be transparent.
One that mandated masks, so they may go optional also.
They've called another meeting.
Bridgeville?
And I know we're having a lot of discussion here and thinking a lot and everything, but we don't represent ourselves sitting here in this board. We're representing the people that are in the community. And when you look at the survey that was put out, and you look at the things that we've got here, there's really not much choice for us to make other than to follow what the community wants. And the community wants optional masking. Even the community at large, there was what, 109 responses? That was still 75% or so. I'm not saying COVID's not real, I'm not saying it's not threatening to some people, but I've never been a big proponent of living in fear, and that's what we're doing right now. We're living in fear. We can take and vote to go optional and revisit this at harvest break or whatever, and not just look at cases, but look at the severity of it, because the majority of people I've heard from, it's a common flu, it's cold, it's a headache for a day.
But
Some people, like Grace, I mean, she's got effects that have carried on, but we need to look at the majority, not just individual cases.
You know, I hear you, Gary, because when I got it, I was like, that was nothing, that could have worked. I mean, I just had like, you know, a headache and lost my sense of taste and smell, no biggie. But then after, it was like, holy cow, this thing just doesn't go away. Thank God I didn't get the variant. That's all I kept on thinking, because just having COVID-19 was bad enough in the long run. I'm still, you know, I don't know, Peter, are you 100%? No, he's not either. My son isn't either.
Peter
So,
never
I
was.
don't know.
That's
right.
You set the bar too high here.
I'm just letting you guys know, like, the reality. I don't know if anybody in here had it or whatnot, but.
I had it. It was nothing.
And my son has no
Leroy.
residual effects as well, and he had it.
Awesome. So glad.
I'm alive and well.
And if you look around right now, I mean, our kids have been together all summer long, picking up trucks and boats and doing everything under the sun. How many of them are sick? Let's not punish them any more than what we have the last year and a half. Maybe we can go through it normal. If we don't, then we may have to change. But we don't need to mandate masks right now. The community has asked us not to.
Sorry.
Go ahead,
I guess I
Al.
have one question. So like we've heard obviously from the parents and students on the survey and things like that, but I guess I want to hear from teachers and administration, you know, what their thoughts are or what their fears.
That was one of
That was one of the surveys.
Yeah.
No, but
but they were
could've
kind of
been one of them.
50-50 as far as the high school. And I heard Grace and I talked, you know, to some other teachers, but I guess like I don't consider myself to have much of a vote. I'm not in the school, I'm not a teacher, I'm not a parent. You know, same with people filling out the survey who were just, you know.
It's extremely hard teaching with the mask.
Okay.
Especially when you're not, because some of them are just learning how to talk.
And
You know,
they need
and
to
to
read
read.
the sound.
The
The sound.
sound.
They need to watch your mouth,
They
they
need
need to see your face,
Yeah.
they need to watch the
I know
movements,
my
your
son
jaw,
watched
your
it.
tongue, your teeth. All those things are so important at the young age.
But on the other side of that too, they did it. You know, it was extremely hard, but they did it. And I also want to say, I taught summer school,
Yeah.
Wonderful. It was really good. But there were the the fingers up the nose, fingers in the mouth. And I was like, I didn't see that at all this year. Didn't see that at all with the mask.
Have you seen it inside of a 4-year-old mask?
But
when
did
they
we
come
have
home?
any?
No,
It's
never
disgusting.
saw it.
It's disgusting.
Did we have any COVID over summer school with the fingers in
Well,
the mouth and up the nose?
I don't understand what you're saying. Like,
The inside of the mask, when
Inside
the
of the
kids
mask.
come
They
home
take it
and
off
they
and
change.
they.
It's pretty
It's
nasty.
disgusting.
That moves
Oh,
to
yes.
more.
Oh,
wow.
the
Never had
children
that.
get
Yeah.
lick it.
Are they super hear from people? We're not here when they're talking over each other.
Yeah.
This is not
Yeah,
right when
I would
I'm
like
done, by
to,
the way.
I would like to follow up with Abby, and I'd like to hear from Robbie and John on their thoughts as building administrators.
Okay, well, the first thing is you have to commend the students of the community because from our youngest learners really going up to 6th grade, we had very, very, very few mask issues at school. And really the majority of the mask issues were the mask kind of falling into the nose a little bit. And it was a quick, pick up your mask and the mask went into the nose and that was fine. So one of the things that you guys are talking about is the effect on student learning. So when you look at our younger kids and, when you're teaching them how to read and you're teaching them how to voice different letter sounds, you really do need to show them. You can't show them that behind a mask. So there's no doubt that there's an effect on learning from wearing masks, both from the student point of view and from the teacher point of view. And I think our teachers had a difficult time as well. It seemed more of an adult issue sometimes with the masks because our teachers are talking all day long. Our kids are not necessarily talking all day long, even though my kids talk all the time at home. But that's an issue as well. We do have to be mindful of the health of our staff. But I will say this, if universal masking means that our quarantining is only the few kids around that particular student that's positive, and we're not sending large groups of students home, I'd rather see masks. If masks don't do that, then there's no point in the masking because we're not saving kids in school. The number one thing that we need our kids is to be in school. And I'm for whatever's gonna make that happen.
So is that really true in a small community? So I look at my sister, right? Her son goes to Messalonsky, which is one of the bigger schools in Maine, right? The fact that her son wasn't hanging out with everybody else in the class on the weekend without a mask meant that he could go to school because they just didn't know who we hung out with that weekend. But here it's different. And so a lot of the cases that we've seen in the last year have been because kids were out and about outside of school. And so even if they're all wearing masks in school, it's not going to make a difference. They're not going to go to school more because they got it outside of school and all the kids around them who are also wearing a mask in school are going to have to stay home. Whether or not that kid tested positive in school that day. It's because they were hanging out with each other the night before. And we all knew it because we all know each other.
No, but that's incorrect, right? Because if,
Yeah, community spread dictates what's gonna happen in your school. So if you have a ton of community spread, it's coming into your school.
Right.
but if you have, like you said, if there's a kid in class that, and everybody's masked, and there's a kid in class that tested positive,
The kid that's 6 feet away
does not have to
But the
quarantine.
kid he hung out with that weekend, does he have to
Without
quarantine?
If he's positive.
If he's positive, but I don't do contact tracing for the community, only for the school. That's up to parents, you know.
John?
Yeah, I totally agree with Robbie. I think the key is, the last year and a half, our kids have missed out on a lot of school. And I think that's the bottom line. We want to keep kids in school. And even if they're out on the weekend and they are hanging out without masks, still having masks on in school will reduce the spread, okay? There's no doubt about that. And then we will have fewer people being quarantined. Case in point, just about, I think how effective masks work. I had an optometrist that came down with COVID, and she didn't know it the day I had it. Next day she was diagnosed. She was, less than 3 feet away from me. She had her N95 on. I had a mask on. I didn't get it, and I was, a good 15 minutes there asking, answering questions. So I really feel the masks, work if they're worn properly. I have just nothing but awesome things to say about our student body and our staff. Last year did a phenomenal job wearing them. There was times they went down, but you asked them to put them back up. and they would. And, you know, we've got, I think last year compared to the year before, we, you know, had a pretty decent year last year. But I really can't think our kids, especially at the lower levels, can handle missing more education, you know? So I guess when it comes to that point, you know, I'm all about the education here and, you know, not really, you know, trying to say one way either or the other. But just having them there will keep less people from being quarantined. It's gonna happen sooner or later. I mean, it's inevitable, you know, so I mean, if we start it now, it could be a good thing. You know, it's not easy, but we've done it before. I think we could do it again.
Manish, is the variant, COVID-19, is it as easily spread as the variant? Or what, okay.
The variant is twice as contagious as what we dealt with last year.
Okay. Because living in the same house with my son, it took me like 15 days to get COVID. I was quarantined forever.
Where last year, one person could potentially spread it to 2 or 3 people. Now that R naught factor is 1 to 9, so a positive could potentially spread it to 9.
So basically, we're all maskless right here, sitting right close to each other. We all feel pretty comfortable.
Nobody has it.
How do you know? We don't. How do you know?
Somebody in that.
I think most everybody in this room has the
I
alternate
could be
vaccine.
vaccinated and still have it.
Okay, I'm gonna ask that the discussion, be limited to the board now, so we can prepare to make a motion.
She's been waiting.
Tamara?
The only point that I want to make, because I too am not a doctor, and I can't, you know, say that what they're saying is not correct. I can speak from a teacher's point of view, and yes, we all did do a really great job last year at wearing those masks, but we went to a reduced school year, or school day. And I will tell you right now that as part of the association, we will fight to have that reduced school day again, because we could not have physically, emotionally, mentally have done that from the moment we got in until 3:15, which is our school day now. So we are looking at going back to affecting kids and parents in the sense that we will need to look at that again, because we can't do 7:30 to 3:15 mask. And I know the comment was made about, but outside they won't. Our children have a 15-minute recess, either in the morning or in the afternoon, and they have a 20-minute recess at lunchtime. That's it. That's not teachers getting that amount of time to take their mask off. And I know as wonderful as Ben has been, and Robbie, and encouraging us to take our kids outside and take them out, they lose learning time. And we can say all we want, that take them out for learning, take them out. Try to rein in 22 third graders and teach them a lesson outside when there's lots of other things going on. And then also, you take them out and then it's that much more when you get them back in to settle them down. Even if you take them out for 5 minutes, then they run, they get hot, they get sweaty, you come back in. I love the idea of outdoor classrooms, but we live in Fort Kent, Maine. In another 3 weeks, we won't be doing anything like that. So those are kind of some of the things that I think we need to consider on top of the mask, no mask. What else comes with the price of the mask? Yes, I don't want to see anyone get sick. 3 of my family members all had COVID as well. I was vaccinated, I did not get it. They don't have any lasting effects, I'm grateful. I don't want to see anyone have to go through it. But I think sometimes I do feel like we're living in fear all the time.
Thank you.
Thank you, Tamara. Okay. We'll go around the table again. Toby, do you have any additional thoughts?
You and I aren't gonna agree, Gary.
We never agree.
It's easier that way.
Did one.
Yeah, one time. Remember that? Put it on the wall.
Great moment.
So I guess the question is there any place in the middle? Because I'm looking at the crew and we've got a mixed bag here. Leroy's gonna do whatever you say. We're not sure where she is.
It's not a case
She's
of what I
leaving.
say, it's a case of what the community has asked for, Toby. You
Listen,
saw the
first,
survey.
I can't.
You've
I
heard
can't-
what's here.
I can't say, listen, let's move to ignore everything the CDC and DOE tell us to do from here on out.
We
That's a
need to-
motion, there's a motion.
We need to focus
There's
on
a
our
motion on the
communities.
there's a motion on the table, Gary. Anybody want to second that? We
Are you
ignore
running
all
this-
DOA.
Are you running this meeting or am I, Toby?
You are, I just made a
I asked
motion.
you for input. I didn't ask you to run the meeting.
I'm allowed to make a motion, Gary, I just made a motion.
Yes, you are. But you're not allowed to ask for a second. Does anyone want to second Toby's motion?
Okay, so
Motion's
now I'd
dead.
like to say what I'm gonna say, which is, when do we stop and start listening to what people above us who know what they're doing are telling us to do? Where's the line? Because I'm having a hard time with that. That's the piece I'm really struggling with. Because I'm not a doctor. I'm not an epidemiologist. I'm not a nurse. I can barely take care of myself. I know the community I know some of the community has a strong opinion, okay? I recognize that. But I don't know, it doesn't feel like just ignoring what the CDC and DOE is saying is wise. And that's what's bothering me, is like, I'm inclined to, I mean, if my kid gets hit walking across the street, I don't go to Facebook and check what I should do, I bring him to the friggin' hospital. Because the doctor knows. Facebook doesn't know, I could check YouTube, I'm sure there's somebody there who can tell me what to do. But they don't know. I mean, if one of your kids got hurt, would you trust the doctor, or would you put it out to a vote? Where's the line? What do we draw here? At what point do we rely on the people who know what they're doing? At what point do we trust our guts? And I don't know where that line is. I mean, if we want to talk about where the line is, I'm willing to discuss that. I'm willing to move off of an absolute mask mandate, but I need to know there's a line here somewhere. At some point, we got to turn the corner and say, look, we need to reevaluate this. And it can't be, it's got to be something articulable before we reach there. Not like last year where we like passed the line, like, oh, we passed the line. Like, we need to know where the line is, so when we cross it, we make the decision. I'm not comfortable just playing it by ear, because it'll look like we're just making it up as we go. And that's not a plan. That's chaos.
Well, that's what 13 other school districts in Aroostook County have done so far, and the 14th one is likely to reverse theirs. I'm not saying the CDC is wrong, Toby. I'm just saying it doesn't apply to our region at this time, and we should not be living under something that doesn't apply to us.
Did the CDC say it doesn't apply to our region? Is there an asterisk on the
It does
CDC?
raise a substantial risk.
That's what they
Where is
say.
it? Where is it, Toby?
What I'm saying.
That's all I'm saying.
I get you.
It doesn't apply to our region at
But
this
when does
time.
it, when does it apply?
When people start getting sick.
Who?
Whoever.
How many?
We'll figure that out at the time, when it becomes a problem.
For
We can't
who?
live
For you?
in fear of something becoming a problem.
When it
that's
becomes
not
a problem for
us.
who though, Gary?
The school,
So,
our communities.
how many
If all of a
kids-
sudden
give
we
me a
got people
number.
getting
How many-
sick,
how many
it's not
kids?
a number.
But it is a
needs-
number.
No, it isn't.
It's epidemiology, Gary. It's all about numbers. How many sick
It
kids
doesn't
do we need
to be
before we
numbers
revisit
for us
this?
to make decisions. You can base it on common sense.
No, we don't make scientific decisions on common sense. We make scientific decisions based on numbers. When
And
you
what-
went out there measuring fish when people were fishing, did you just look at the fish and on common sense decide it was undersized? Or did you take out your ruler?
Let me ask you something. Why is the southern border not closed? If what the CDC is saying, that this is so severe and so bad, why are we allowing all of these sick people from Central America into our country? We're busing them around, we're flying them around. If it's so bad, wouldn't you want to stop it right there? Because all that is doing is creating greater spread.
What the hell are you talking about? I mean, we're talking about a policy here for our little town in northern Maine.
Right, but
It
you're
doesn't
saying-
matter what happens on the southern border.
But you're saying the CDC has all the answers. If they did.
No. I'm
the
saying if
border wouldn't
somebody
be
else
closed.
had an answer, I would entertain it.
We're gonna move on. Leroy?
I spoke first, obviously, and I still feel the same way. I'm willing to compromise to a certain degree. I mean, I think that maybe we should, at some point, revisit it to see where our numbers lie. But I don't think that having a universal mask mandate makes sense for our community, and that's exactly what the community members have portrayed to me, so I represent them.
Yeah.
Well, while I don't like being thought of as the swing vote,
Sorry, Abby.
I think after hearing everyone, to be honest, I don't put a lot of value on the signatures just because a lot of them were people who are not parents with schools in the district, like me. Like I don't want to well, I guess I'm on the board, but I wouldn't want to decide for parents or teachers or nurses or doctors what goes on in the school. But I think after hearing, what the teachers, parents, with Winnick's, comments and Dr. Roberts all involved, I think I would be swaying more towards optional, with the idea that we do say, like, at some point, if the community is at a severe level, or whatever the word that they did use, then we need to, reevaluate. And if that's, say, okay, at this point, then if this many kids in the school system are sick, then we need to go fully masked. I would rather that as opposed to a hybrid model or remote model, because obviously that's where kids are missing school. And I think for me, to Mara's point, to the point where if we're wearing masks, then we're cutting out, an hour and a half of the school day, or we're missing learning time because we're transitioning outside, or, to different models. I think that is a bigger waste of time to me than wearing, missing days, or wearing masks, having to cut the short in school day. If they're in school for the full, 8 to 3:30 or 3:15, whatever it was, with masks, and it's, looking okay to do that as our community spread might change, then that's what I would go for.
Isabel?
I'm still standing with the full optional, and I'm not a parent, I don't have kids, I'm not making any decision for kids, but the people that I represent are obviously leaning towards the optional choice just because of what they've seen throughout the summer, their kids going to rec programs, and everything like that. I mean, say if next week we have this massive community outbreak, then that's a completely different story, which is where I think we need to have that, yes, that magical number, where once we hit it, okay, maybe we do need to mask at all times during school. So that's where I am.
Well, I'd like to have more accurate, I don't want to say more accurate, but more real-time data as far as hospitalization rates for the county and for the valley, number one. I don't know if we can be provided with that data on a more regular basis.
I'm sure if I ask, they'll watch me, or at least help.
Yeah. Well, like I said before, I think at the elementary school, I really think it'd be in our best interest for those students to be masked, but at the middle school, high school level, definitely optional.
Sarah?
I think Abby and I'll actually have it easier to make this decision because you're not tied to the personal aspect of it. I have a really good ability to separate things, and it's funny, I have not thought about personal at all. For me, I know you have issue with CDC and how it applies locally. What applies locally to me is our nurse, our doctor, our administrators, who all said universal masking will help our kids stay in the classroom where they belong. That was what I heard from them. I agree that maybe, or I agree with some of the others as far as there needs to be some sort of trigger point as far as, okay, low transmission, that seems excessive. I don't know where the line is for me. Is it between moderate and substantial? Is it between substantial and high? It looks like we're on the high side of substantial with an uptick. So I think Toby's right in that it would be nice to have some discussion before we get all the data. Let's make a discussion as so we don't have that personal We don't have the who's affected. These are the numbers. If it gets to this point, then we call it. We can have, Ben checks these daily. We can maybe ask the hospital to provide us numbers weekly, bi-weekly, something, but I think it has to be local. I think the DOE is recommending unvaccinated people be masked. That's the elementary school. At the bare minimum, I guess I would be, where we're seeing an uptick and we're close to high, our nurse, our doctor, and our building admin are thinking at this point universal masking, and if things die down, I know you don't see it as high right now, but you don't see it as high until it's happened. And when this all happened, Ben had said something that kind of rung with me is, we'll never know if we overreacted, but we'll sure as heck know if we underreacted. And I feel like that's where we're at again, right back in that spot.
I think our best course of action would be to set a reevaluation date on it, something like after harvest.
Too far.
If you remember last year, we set numbers, trigger points. We went back and revisited those and changed those and eliminated them because they weren't effective, they weren't realistic. So I think we have to be careful in setting numbers, and I think we just have to look and continuously monitor it. I mean, we're not gonna vote to go optional and then take off and show up next June. We're gonna launch this, we're gonna look at it, but we need to use common sense. I've got the floor, thank you. So basically what occurred is everyone wants to look at this as we go again through the year. So I think if we're gonna make a motion, if someone wants to make a motion, our next meeting is September 27th. If someone wants to make a motion, then it should include a date that we revisit, which would probably be September 27th at our next meeting, and see where we're at.
I have a question for you.
Yeah.
If we're going to revisit, I guess it comes back to Toby's thing. Who are we getting the input from? If we're gonna make this
Ben is monitoring. I mean, you heard him, he checks every day on different things.
I understand, but our nurse, our doctor, and our two building admin are suggesting universal masking at this point tonight.
And the community is asking by at least a 75 to 25% vote that we go optional, and that is who we represent.
I guess I still
So,
Let's just remember that's a small sample, very small sample size.
And I voted 3 times.
Yeah.
So with that, would anyone like to make a motion?
I would not like to make a motion, but I hear from a lot of parents that, you know, the COVID data tracker, it tracks, right, Aroostook County as a whole. I hear that Ben was also able to contact Fish River and Northern Maine Medical Center for their positive numbers. Is it a possibility tonight to try to please not everyone, but maybe a majority, that after we get so many positive cases in our area, not Aroostook County, that we have some, doesn't have to be as formal as a meeting, but maybe, you know, an email to discuss?
So one tool that I'll just draw your attention to is on the screen. This is the Maine CDC, and it actually does cumulative cases by zip code. So, you know, Fort Kent, as of August 8, had 160 cumulative, probable, and confirmed cases. It's not up to date, so again, that's August 8, we're on August 16. I imagine that when we meet again, and when you guys determine we meet again, we can compare today's data with the data at that point. It's not gonna be a perfect science, but at least it'll show us if that number is moving up or down. I can do it for each of the SB 27 communities. That's just another tool that I can use. But I'm more than willing to communicate and be in communication with Northern Maine, Medical Center and Fish River and whoever else.
That number's for the calendar year?
I think that's all time.
Ever.
All
Always
time.
has to
But it
start
could be
at
baseline.
So
Yeah.
18 months.
It's 174 positive cases in Bristol County right now, as of today, 174 total. So that has to be cumulative.
Yeah.
When you look at the color map that the US CDC puts out, and you can look at the counties, that we're a week behind, so we're going on a week ago's
Oh, okay.
data. And that tracks from your Walgreens, as well as your hospital, as well as your Fish River, as well as other places that test. Because I'll tell you, the majority of people will go test at Walgreens. You register online, and within 24 hours you can go. So we can get numbers from Northern Maine Medical Center and Fish River Rural Health, but you're missing a huge component.
Is it possible? Has anyone asked Walgreens if they're allowed to give out?
And it's reflected in our substantial spread in those colors.
Okay,
That's
thank
what
you.
the state tracks.
What do you think we should do, Ben? You're the boss. What do you think we should do? What'd you do?
I have a hard time with our elementary population just because they're not, or they have not had the opportunity to be vaccinated. I don't struggle as much with the middle high school level. Everyone has had the opportunity to get vaccinated. That being said, there's a lot to be said about other issues that exist with all of this, not just the masking. We're focused on masking today, but there's so much more that we're not talking about. Social, emotional things that have happened because of all this, and the mask is just the villain that we're all putting everything behind. It's just a piece of cloth, and some kids wear short sleeve shirts and some wear long sleeve shirts, and it is what it is. I struggle with all of that. I struggle with giving a recommendation to all of you because I too am not a doctor, so I always defer to what other people are saying. And anybody here can go online and find a doctor who is saying the opposite of what Dr. Roberts is saying. I mean, we've all seen that, and so there's so many varying sides to this. It's impossible. What you're asked to vote on today is impossible because you are satisfying half of the people, and half the people will not be satisfied. And that's, even though the survey says 70, it's going to be half and half, no matter what. So it's an impossible task. And every school district in the United States is making this decision just as you are. Every school district. I feel comforted in the fact that we live in this little area of northern Maine, and it's probably not going to get as bad as it will in other areas, but that's not a guarantee either. When it hit us last January, February, it hit us. I mean, it spread fast in the communities. It's impossible. I don't know. It's impossible. I would highly recommend, though, if I have to give you a recommendation, if you go with optional masking, I would highly recommend you push for a pool testing program, because at least with a pool testing program, you can add another layer of kids that maybe won't have to quarantine. And let's hope and pray we get 30% of the population to sign up for it. Because that's another way we don't get those kids out of school if they're close contacts.
How does that work?
Do you guys want to know what
Yeah.
pool
Yeah.
testing entails?
Yeah.
Okay. So pool testing is a program where everybody in the school, everybody, staff, students, is swabbed at least once a week depending on community spread. The school gets to pick which day that is that you test. So the testing coordinator would go to each classroom. Everybody who has signed consent to participate swabs their own nose. It goes into a community tube. It gets labeled classroom A, classroom B. That gets sent to the lab in Boston. 24 to 48 hours, we get a result. There was a positive. It all went in the same pool, so we don't know who the positive is. So for the next 2 days, we antigen test everybody again in that classroom to find that positive. You continue to antigen test, you find that positive. That's done everybody, every week.
Who
And
signs
then-
up? Who signs up?
Who signs
Who
up?
signs up, yeah,
And you're looking for a 30% threshold.
yeah. And the premise behind it is if you're testing weekly, you're catching asymptomatics, so you're catching early spread. And you're able to remain in school if you're participating in that testing program, even if you're a close contact.
So
And
Nick,
not masked.
For the parents of our younger kids,
Yeah,
can you explain how invasive that first initial swab is?
it isn't, it's anterior nose, so it's
Anterior.
nowhere,
They do
if
their
they
own.
can pick their nose,
Yeah, I
they
just want
can.
everybody else.
I got a
And in
quick-
places where they've implemented it, that the children are actually proud to be doing their part to keep their schools safe. So they do get right into it, and they're very willing.
So like literally, this is a quantified, this is another option that we have that would give us a tangible, quantifiable, true snapshot of what is going around in the school. Not, as we referred to, as you said, that, the mask being the villain and whatnot. This is an option that gives us, as Toby said, a quantifiable numbers situation going on, and I think as a community, that would be our best,
And we
And it
also,
keeps kids in school.
Yes.
that's the whole.
We
We
do
also
need to
wanted-
fund someone to coordinate that.
We have-
You're raising your hand. You're raising your hand.
You're raising my hand?
Yeah.
No, I wasn't. I'm talking with my hand.
Isn't there COVID funding? Isn't there federal COVID funding?
Yes.
Okay,
Yes.
so then that would take out of the budget?
and we also have the rapid Binax now.
Yeah.
We as a school could opt for doing a percentage of rapid testing on our students. That's also something that had been talked about a while back.
So you asked for, you mentioned earlier, Toby, that you're all open to options. I think this is, for me, the only other option you have. If you're gonna go optional masking, you're gonna have to have some kind of mitigation level with testing to outdo that lack of masking.
Yep.
My kids will be a lot happier sticking a cotton swab up their nose than having.
Oh, yeah.
I'd like to make a motion if I can. I'd like to make a motion that we go with the optional masking with pool testing, and we revisit this at our next meeting on the 27th to see where we are from now to then.
Can I have a
Second.
Can I have a question on?
After a second. Do we have a second?
I'll second that.
You're saying K through 12, all optional.
Mhm.
I have a second question.
Pre-K.
I'm sorry.
Yeah.
If, let's say, there is an influx in cases in the area, like we start school next week and the elementary school has, 10 positive cases, is there a possibility of revisiting before that September 27th?
I think as in the past, Ben's contacted us and said, look, we need to have an emergency meeting. If something blows off the scale, then yeah,
Okay.
most definitely.
And I can add that to the motion if you'd like.
I would recommend if we were designated as an outbreak school a couple times last year, if we have that, we should definitely meet
Okay.
immediately.
How many outbreak schools were there?
Oh, lots. Three or more cases in your school designates you as
Different
an-
families within
different families.
14 days.
Any further discussion?
Was he gonna change the motion or no?
Amended
Want to retract that
include-
motion
To-
and add
Yes, can I
At Ben's.
amend it to include the, at Ben's discretion with reaching out to the school board?
Yes. You second that?
I second that.
Go around the table. Toby, yay, nay?
I would have been happier to have had something for the littles, separated out between the littles and the big kids. So nay. If we have to revisit it, that's what it would take to move me.
Leva?
Yay.
Ab?
Yeah.
Yes.
Yes.
we're still doing masking on the buses, right?
Yeah.
That's mandated.
Well, the poll testing is definitely a preventative, cautionary measure, proactive measure. I don't think it's a complete 100% substitute for the masking for the little kids, but that's a healthy compromise, I think. So I'm okay with that.
Sarah?
I'm a nay.
Surprised, but I'm a yay. So the motion carries 5-2.
Can we go home?
Yep.
Gary, can I just ask a question to the group, or even to Monique? How can you make sure you secure those 30%? Is there gonna be like an informational because the pool testing requires 30%? I'm just curious as to how you're going to secure that 30% to make sure that it's
You
effective.
have to ask Nick on that, I
It's,
guess.
it's all through parents consenting and turning back in the paperwork. So they're consenting to the pool testing and to the repeat antigen tests weekly.
But I'm just like, I
How
hope
are we
that
gonna
they, I
handle
hope they
this?
understand the value of it and what the meaning of it is in regards to, it buys them that freedom of the potential for their child staying in school. I
Right.
guess not everyone's,
They,
no one's
they
gonna
get
wanna
to
have
stay
their
in
kids
school,
swabbed,
they
you know?
still would quarantine outside of school, but they would still.
Yep.
They would not
But-
lose their in-school instructional
Yeah.
time, and we will
Oh,
promote
I
that.
understand,
No.
yeah,
But I guess what I'm saying is we are gonna promote that,
okay.
to let them know that this is one way of ensuring that our students can remain in school for instruction.
We'll have some videos.
If we don't have 30%,
Then you won't have pool testing, so
We revisit.
we'd have
We
to
would
come back
revisit.
and revisit. So that's all gonna be part of the messaging, we'll try to put out something tomorrow and really try to educate, what this decision was and how it's hinging on pool testing being successful, to keep our kids safe.
Okay. Maybe take a 5-minute break before we move on to the minutes, finally.
that was Colby. No.
Hey, I wasn't picking on you when I said.
Oh, no, no, I got you. Don't worry about it.
Meant that it was two,
Yeah.
I don't know, yeah, maybe.
the 898th meeting, June 21st, 2021.
Motion to approve.
Second Leroy. Any discussion?
No.
Was there something? You had mentioned something.
Oh, there was just, current opening, allow superintendent to fill remaining vacancies over the summer. We had clarified that,
Yeah, okay.
72 hours, that wasn't noted.
What now?
Right. We did that.
All in favor? Unanimous. Superintendent.
So I did invite our personalized learning team here. I thank them for waiting patiently. They did want to update you on their cohort, how things are going, and what their plans are for this year. So without further ado, I'm going to turn it over to them to come up and present.
Thank you.
And my laptop is here for you guys to forward.
Thank you very much, Mr. Martin.
Are you going to forward the slides, Mr. Middleton?
Two?
Oh, that's nice. Oh, that's nice.
Thank you.
A little bit of update on Project Rise, but we really felt more comfortable doing it in terms of the personalized learning update, which is a journey the district really started years ago with a woman named Dee McGarvey. So we had sent down a lot of educators down to Augusta, and Dee McGarvey came in. Dee had worked with Marzano, which really was kind of the trail that we were on as a district. So really we started with Dee McGarvey, the book Inevitable. I think she's written another book kind of to add on to this. Some of the specific elementary. That was really the beginning of the personalized vision for MSAD 27 was to work with Dee McGarvey. So just a quick recap of what is personalized learning. It's an educational approach that aims for each individual student for their strengths, needs, skills, and their interests. Okay? Very quickly, we'll take a quick look at this link. And this link is the Personalized Learning Continuum for MSAD 27 and the other Valley Unified Schools. So we talk about what traditional classrooms look like, moving into differentiated instruction, which we've been differentiating for decades now. So that word is something that every educator knows. Going into more of a personalized learning environment. This is a little bit difficult to read up here, but we can share this particular chart with you guys at any point. But the idea is that learning becomes more personal to students, not just in the sense that, not just in the sense that they're getting what they want, which I think is also a misconception added to these three, but really targeted towards what they need. So in terms of skills, what does this particular student need for a skill? That's something that can be worked on. And hopefully allowing for some individualization for what they want to be learning about. A couple misconceptions with personalized learning, and this is really throughout the realm of personalized learning, whether in stage 1 through 3. Technology is the key component of personalized instruction. Teachers are the key component for personalized instruction. Students predominantly do independent work. You'll probably see a lot more small group or individualized lessons with teachers within personalized learning. And then personalized learning is basically students moving at their own pace. One of the big things is the student and teacher really look at what is the pace for that particular student. So in Dee McGarvey's words, time is a variable, not the constant. So, FKS, Project Rise is doing a great job, but FKS, there's a lot of other things going on at Fort Elementary School that are enabling us on this road to personalization. The first one is with your support, starting a couple years ago, we started talking about a reading curriculum. So we now have My View, Amplify, and My Perspectives as our reading curriculum at the elementary school. We also recently purchased a math program as well. These new programs are great. They really allow us to hit each student at their individual level. Flexible grouping, Tamara talked earlier, our flexible grouping grade three's been doing this for years, where they really look at where the students are at, and the students are able to move amongst the different groups within that. So you're looking at less of a span of our teachers really having to reach, where they can really focus on what each one of those students needs. Mission math and reading, which is something we're starting this year. So we're able to take in our kindergarten to grade 3, where we have 4 kindergarten teachers for grade 1, for grade 2. We've actually split up those groups into 5 groups. So every group will have a smaller class size to really worry about, educate, and teach, which allows them, again, to be more individualized and personalized with their instruction. We have win time. It used to be called enrichment and, somebody help me? Remember? You should remember. Intervention and enrichment, but now we call it win time, which stands for what I need. And during this time, it's about a half-an-hour block where kids really get that specific instruction on skills that they are lacking. So it's not a study hall. It's not get some of this work done that you didn't finish earlier. It's supposed to be individualized to what they need for specific skills and standards. You guys can stop me anytime you have any questions. Some other things we have going on. We have a grade 4 learning community. So we have Miss Amber and Miss Sam. They work together. They co-teach. The door is always open between their rooms. And really at any given point, I could go down, and if I'm looking for Abram Netto, he might be in Miss Sam's room for instruction. He might be in Miss Amber's room for instruction. So they really work and teach together. We have a grade 1 and 2 community that's doing things that are very similar, very center-based learning. And again, depending on where the kids are at and what their needs are, they'll be at certain centers. So, yes?
Is this presentation specific to RISE or just?
This is specific to Fort Kent Elementary School. So we'll be talking a little bit more about RISE in a couple slides. And these are just a few highlights. So I took some grade specific ones, but there are teachers that are doing a great job in individual classrooms, working with other teachers, working within grade levels to really personalize and make learning great for all of our kids. So it's hard to really pinpoint every great thing that's happening in our school, because I can go to every classroom and pinpoint multiple great things happening. So now we get to RISE. Which, on the agenda here, you see where it says Project RISE. So at the elementary school now, it's no longer a project. It is RISE, and it's part of what we do at Fort Kent Elementary. Same with our grade 4 learning community. So our grade 4 learners coming from UWing, they're coming into RISE, or they're coming into that grade 4 learning community, and really getting a great personalized education. So part of our school, it's evolved in the past 3 years. I think, we have some people that have some learners in here already, and they hopefully will have seen a big difference from what we started with 3 years ago with 87 kids, just getting started, all new processes, all new procedures, and now 3 years later, in terms of what we've become, it's really quite an amazing journey. And we really do have to give our teachers here, I would say, a round of applause for all the work that they put in, because there's nobody that works hard for this group, doing what's best for kids. And now I'm going to give it over to them, because we really want to know what they do.
Thank you, Robbie.
Careful, don't slip somebody's good water. Giselle. Do I get to get the mop? You want the water out of my hand?
Crystal's very active.
He does it all the time.
Yeah, keep Crystal on this end too. Well, thank you for inviting us. We're really excited to share and answer your questions. So I have to apologize first for the cheat cards. A personal goal that I have is to better myself in public speaking, and I'm taking baby steps. Why would I want my child in this kind of learning environment? Well, that's a great question. RISE is where the learning environment is transformed by learners and their team with guidance from their facilitators to redesign their own innovative approaches or systems that support who they are. This is self-empowerment.
And it's just another way of saying personalized learning. At some point, we all had separate classrooms. administration came to us, talking about RISE. It was open to all teachers to apply. That's how we ended up in this program. Here's this personalized learning continuum. And what we're doing is we're trying to move as educators, and we're also trying to move the learners, for them to be more independent. And we're providing learning opportunities where they can become more independent in their learning. And there's something called learner agency. You've probably heard us use this term before. That's where the learner is taking more responsibility for their learning and making decisions. When they come in as fourth graders, a lot of those decisions are guided decisions guided by the facilitator to help them in making choices. As they move through RISE, our sixth graders become quite independent in making decisions. Making wise uses of their time. An example I'll use of that is if they have a half-hour block where they can be working on math, and all their math is caught up, but they have some science that they know is due and they're not done that yet, they'll just come see one of us, ask if they can change their schedule to work on science instead of math during that period. We get real excited when they do that because they are steering their own learning. That one. Oh, where we are, we're at a lot of tools in personalized learning, but we're also seeing ourselves as educators, not all of it, but specs in.
We're able to move like our learners from them out of 2 into like a 3 level where they're more able to make their own decisions without so much of our guidance. And that's our goal after the end of those 3 years, 3 year spans, to have that happen. So we don't expect that to happen right away. And we're still learning as well with them because every group of learners is different. But there's... She's ready. Thank you. Okay, so we talked about scheduling, so I'm not going to spend a lot of time on this because I know you guys have a lot still to discuss, but I do just want to show you using feedback from students, from parents, from community members, from everybody over the last 3 years. We've really kind of found the best way to deliver information. So yes, there's Empower. However, parents aren't like, yay, Empower, I can maneuver this and find everything. So we found this worked really well. And we kept going back. This is my daughter's schedule. She has recently moved on to the 7th grade, and she was the first group we had for 3 years. It was really hard to see them go. We'll talk about that again in a minute. But this worked really well. And it also went from, well, last year, I know that remote's not an option this year, but it transferred really well from remote, hybrid, and in class. Parents have a copy of this. We have a copy of this. Students have a copy of this. So they save it on their desktop, and it's easy access. So look, all your Zoom links are right there, right? So every kid has, during the course of a day, either a math seminar, well, they have all their core subject seminars with us each day. You'll notice there's some open blocks where there's no links. Those are independent and work study times. We don't expect them to do that right away when they join us. That takes time. Boot camp is starting up in next week. My goodness. So we spend the time working with the kids and building that stamina to be able to work independently for, well, usually it's between half an hour, 45 minutes. But they can get up, they can, it's not sit all the time. Stay in your area though, because we have our seating plans. Right. So that's how that works. So eventually, during this block of time, if they have a seminar with me, and she's on ELA 2, she's working to prepare for what she needs to come to class throughout the seminar. Okay. That's the schedule. You're going to notice passion projects. I'm going to come back to that block in just a minute. So what we do there. Okay, so everybody needs to know what priorities they have. So each subject down below, we have your ELA priorities, your math priorities, and your science, social science priorities. What you have to do is listed down below. And as we meet with them in our bi-weekly conferences, what's been accomplished, or as they pass things in, it's deleted off the schedule. Kids have access to this, and they can alter their schedule unless they need guidance, and then we take editing. So that's been really fun when we get that back. And then for parents, an explanation of the per unit and all the learning targets are there for each subject area, so that was kind of nice. We also have links to our RISE page, which is where stuff is posted, and I'll show you an example of that. Each learner does get their own personal goal. It could be something for core values, like, okay, obviously I'm saying it's my best friend and I can't focus, that might be someone's goal. I'm going to sit and quiet so that I'm going to identify for me. Somebody might already So that was their schedule. Which we're probably going to stick with again.
Yeah, and we have them call it onto their desktop on their laptop. So it's right there.
Our heart and our personalized piece that we work with in our learning community, because RISE is the philosophy that we're all working towards, but who we are as a community or as an environment is those passion projects. So I showed you that passion project block on the schedule. Every kid gets that block, 2 blocks of time. Last year was about 30 minutes, 2 30-minute blocks, where they could ask a big question. Okay, how can I help this? Or like we had people farming chickens, so we have all kinds of chicks in our room this spring. And we have, like I'll show you an example. This page is no longer active, but we had ice fishing. Right? So that's eventually where we want them to be able to go. Ask a good question, do the research, find a solution, improve it, or move on. We've realized in the past, over the last 3 years, that not everybody's ready for that. So this is an amazing, this is really cool for everybody that leads projects, like myself. This Instructable, so we always use Tinkercad with our coding and stuff, but there are so many cool projects on here that are, they break them up by grades and contests, and they're step by step, and they're by interest. So you can get on here and say, okay, if you're interested in art, I'm going to give you this art project, what do you want to try? So it gets them going until they can eventually say, this is my passion. It takes a bit to get, doesn't come, a lot of it will just be what's my friend doing, you know. So.
Yeah, because we do allow them to work in groups if they have similar interests.
This is a link, this is our class page from last year. So like on our home page, obviously, all the links to everything that we use, very similar to, most people have it. Our Showcase of Learning, we had a little guy in our class that, his passion project, he came to us and he was like, I want to showcase all the passion projects, so I'm going to design my own site. I'm not good at that. So he, from scratch, taught himself the computer code and was able to house all the site's no longer active. I can't go into it because he ran out of money on his stuff with us. But anyway, we thought that was a really cool one.
I will say, like, one of the best things about working at an elementary school is walking on the hall. Kids are working on something, they're always excited to show you. And I can't make it down ceiling whenever the kids are working on the project.
So you heard about the heart of RISE. Our soul in RISE is the...
Can I interrupt you, Ms. Crystal, for just 1 minute before you move on? I forgot to tell you this part. If priorities are all met and they've met their goals that they set themselves in their due dates, they have the extra time that week to continue their project. So that's an incentive to keep moving and make my due dates and going and make that. Go ahead, Ms. Crystal. I apologize.
So
The soul of our learning community is in the relationships that have been formed. They're formed with the learners, they're formed with the learners and the facilitators, and they're formed with us as facilitators. Growing, we watch them grow within the 3 years that we have them. This helps us to group and regroup in our reading and in our math centers. This is how we're able to watch them grow and watch them develop as a learner. They build a sense of family with the elders looking out for the youngers. On our last day of school, we sat in a big family circle, and we asked the elders to give the youngers some advice, or what they'd like to see them do or achieve for the following year. And it was really cool, some of the things that they came up with. And unfortunately, you're not able to see little words, whatever. So I took some of the bigger pieces. Some of the elders said to balance your work, to meet your due dates, do your homework the day it is assigned. Take advantage of your time. Do what your passion is, not what your friends is, and set personal goals. So if we had asked these elders, do you guys have any questions for us?
They have to apply to be.
Good. This year,
Rise is one of the placements that we have for our fourth grade learners, just like the other two fourth grade classrooms.
So, I guess do they have to test into it? Do the parents have to apply? Can anyone be in it?
Anyone can be in it, and they're assigned just like students are assigned in any other class.
Originally, when we started, we asked for parents to opt their kids in. But then after a couple of years, we said, you know what, after a few years, it's no longer a pilot anymore, it's just a program we have. Any parent is allowed to, at Forkin Elementary School, they have the option of saying, I don't want this classroom placement. They still have that option. Otherwise than that, Mr. Netto places students in the class based on teacher feedback of where kids will succeed.
Have we identified any students that could potentially maybe be better off remaining in the traditional classroom setting versus one where they're allowed more, I don't want to say freedom, but more flexibility to work in groups at their own pace?
We would be open to taking all kids because in our environment, those kids could learn skills because they're put in a situation where they have to make a good choice about where they sit.
Okay.
So I don't think we keep any kids out.
No, I think more to focus that answer to your question, we've had kids that have come in and have not necessarily been successful in that environment, but there are also students that have not been successful in the traditional learning environment either.
Sure. I just wonder how do we get to the point where we're not going to be in a reactive mode where the students may be several months into the school year and it's really not working out for them, if that situation's even been encountered.
Right, I mean, so when you look at those particular students that may or may not be successful in that type of environment, those also tend to be the same students that are not necessarily successful in a traditional learning environment. Right? Okay. So they're usually there's more to consider than just the learning environment.
Okay.
And in every learning environment, you're going to run into situations where personalities don't mix, or there's something that, whether it's a personalized learning community like we're striving for, or a traditional, you could still run into that same scenario depending on the learner. So,
do we have a similar, or at the middle school, does it is it personalized learning, or is it back more to the traditional, or the, what was the other one, the tiered?
It's more traditional, but we do have some levels of personalized learning based on what the guidance counselor will see what some needs might be and where some deficiencies might be. But I, as a parent, I'm kind of wondering quietly here, like, because my daughter just finished the RISE program. She absolutely loved it. I was able to witness the growth. But what I'm thinking of is, what is it going to be like this year when she starts 7th grade? And how is she going to just fall in, into lockstep with everybody else and just, do that, changing of class and teacher and all that, and how that's going to fare, and I think she'll be okay, because one thing I can say about her during the whole pandemic thing and stuff is she was in charge of her learning. And whereas I heard a lot of nightmares of kids struggling with their education and communicating with their teachers, it was flawless in my house working with the RISE teachers. And she doesn't have to be told. She knows what she needs to do. She's good at scheduling now. she's, that learner agency has really blossomed in her. So I love the program. If anything, I'd like to see more of it, on beyond the bookends of where you have it right now in your elementary school. So I don't know, I think it'd be something interesting to explore at some point, maybe even. And I don't know if there's data out there.
Right. One thing that, you're talking about the transition. One thing that happens when kids leave elementary and come here is that they get to have different teachers, different classes. They switch classes. They have a schedule. In elementary, traditional elementary, you're with the same teacher all day long. This provides an opportunity to have different teachers throughout the day and have a rotating schedule similar to what they're going to experience here. So they just provide that.
The other question I'd like to ask is, what sort of resources have been made available to you over the years that you didn't have on year one? Aside from like the student to teacher ratio, obviously that's better, I hope, right? From what it sounds like.
Yep.
So I'd just like to know, like, maybe from a technical standpoint, or anybody coming in and out of the classroom that provides you guys assistance occasionally, or just what?
I think, like, looking back and reflecting on the growth, how we've grown all together through the last 3 years, I think coming in, yes, our numbers were very large, the space was limited, but we were trying to adapt to a model that wasn't ours. So it took a little bit of time to figure it out. We had to make the mistakes, but that was what's really cool about it. The kids were involved with us.
Right.
So they saw this whole process, and like the crew that just left, like my daughter left with Steve's daughter, that was theirs. They built that from the ground up with us. So that, I just think I wouldn't trade those last 3 years for anything. I think it was an amazing learning opportunity. But we did make changes to the schedules, finally finding our schedule that works, finding ways to get to everybody and provide them with the right amount of instructional time each day. Like this, we're in a good place.
I feel like you guys have asked for less resources as the years have gone on. I would say that.
And I have to credit these three are continuously asking for stakeholder feedback. They're always polling their parents, always asking for feedback, far more than a lot of our other teachers. So they're always seeking that feedback on how to get better and how to adjust. So I have to give them credit for that as well. That's never an easy place to be, to ask what's not working well.
I think for me, one of the questions I would have is, we had a theory, and RISE came from a theoretical approach. Do we have any quantifiable measure? Can we compare, contrast students who went one route from another, see change in average STAR scores, things like that? Can we compare and contrast and see how we're doing? Did it work or did it not? That's the question. I want to see how it, because we're changing all the time, but I'd be curious to see how we stack up, how students, as far as growth goes over the period of time.
Yeah, you go ahead.
And we're looking for that, like, we need to see that data. Unfortunately, the last 2 years with STAR testing has been challenging with, well, I don't need to explain anything.
Why?
We're looking for that data that says, okay, now I really want to see it too, but we do have the data for the last 3 years. It looks different from learners that were with us for 1 year, removed, and then replaced. It looks different, very different from the learners that were with us for the full 3 consecutive years. And also looks very different from the learner that comes in and joins us for 1 6th grade year. Because, so what we need to see is the data lined up for those learners that are with us for those 3 consecutive years. Now that we're established, you know what I mean, and kind of look at that.
Now that the processes and procedures are in place, we need a normal year to look
Yeah.
at, to really be able to look at that and be,
Well,
for it to
yes.
be quantifiable.
But you're gonna be comparing yourself to the, what do you call the thing you don't?
Traditional?
No, like the group that isn't part of the experiment.
We're gonna, the kids will be comparing themselves to the
Control. Yeah, sorry. Once again, we're not a doctor scientist. Control group. It seems like the rest of the students would be your control group. You'd be able to see if you've got an overall average increase in STAR scores between RISE versus your traditional students, and we should be able to see.
Right, yeah, I
how
get what
we're
you're
doing.
saying.
And they've all been through the same thing. I mean, they all went through COVID.
Right, when you look at last year in terms of the processes that they had to adjust to, that weren't personalized within that program. So, for example, really about halfway through the year, they had to go from being able to group and regroup, depending on the reading groups that they're in or the math groups that they're in too. Then we had to say, okay, no more grouping and regrouping. This is your group, this is what you have, and you're teaching everything to them. So it's not really, for them, it's not apples to apples, because their apple turned into an orange halfway through the year. So it's really hard right now to make that, to see that quantifiability.
And also the other learners or the other cohorts, or I said cohorts too much here, but learning communities are also practicing a lot of the same philosophies.
Yeah.
But instead of a grade specific, we kind of have that vertical movement through.
So we always talk about that 3-year group, the group that just moved from grade 6 to grade 7 now. We have an opportunity to not only track, STAR data and all that, but behavior data. If they're talking about learner agency and core values in a way, what's happening when they come here to this building? Are they getting in trouble more or less? Are they more independent or less? These are all things that I think we need to really look at, and speaking with our middle school staff about, okay, this, how are those kids doing? But absolutely, we need to take a look at all that.
That was my next question. Thank you.
I think I'd actually be really anxious to see what this class that just completed in the next class, how they integrate further down the road. I think that's going to be pretty exciting.
That's our goal, is just give them the tools they need to be successful, set them up, so when they do have to function on their own, they have that.
So Ben, you brought a good point. I was gonna say that as well, because it's not always about that STAR data or their measurement that you're looking for. I taught 9th graders, and they never knew what to do. It's like, Miss, just tell me. The learner agency was not there. And so if they can come in with a sense of that, that is a huge skill set that I did not see when I taught 9th grade. So if they're learning that in 4th and 5th and 6th grade, that's amazing.
Ideally, they'll become more productive adults.
I'll let you know.
Check the court notes.
You say check corporate.
No, you didn't.
Thank you, guys.
Thank you.
Thank you.
Thank you very much. So I'm going to try to push through and stop me if you have any questions. Moving on to item D, I just wanted to report that our middle high school will start to report grades away from Empower and go back to Power School. And that's simply because we are not getting the end product that we were supposed to in a comprehensive transcript that that should have been coming. So what our teachers have been doing over the past years is they report in Empower, and then they transfer those grades into Power School. So we've been double reporting and still using a Power School transcript, and enough is enough. We really like the Empower program at the elementary level to show growth over time, and we'd like to continue that, but for middle high school, we're gonna revert back to our teachers reporting scores in Power School, and so all parents will be shared, you know, the Power School password for their children, and that's where you're gonna get your grades. And that's just a decision we made based on, we can't keep waiting for and sharing them, right? Is that fair enough?
That is an understatement, yes.
Who was paying for the Empower program? Was it the Maine Department of Education? Was coming out of our budget?
Our budget.
So we paid for this product and we didn't get an end result. After years of analysis, we really didn't grow from this data that was provided. That angers me.
That's fair. You know what? They
you look at all the effort and time behind it, right?
Well,
All
no,
your
so, because I've been managing it and everyone kind of feels really sorry for me because I put all this time and effort into
I'm not
this
pinning.
program.
I'm not putting this on you, Sharon.
Oh,
no,
no,
whatsoever.
no,
I just
no.
it's the position that
I
we've been
get
put in,
calls
and
every
that
week,
and you
so-
have to input this data and make reports out of it. And
Well, yeah, so I have to say that Empower has allotted us the opportunity to really understand depth of knowledge, to really understand vertically align our curriculum. And with Empower, we could see it pre-K to 12, and there was no other tool out there that allowed us to do that. So the work is not lost. It has improved, but it's not intuitive, it's kind of clunky. So it's been a bear to work with, to be quite honest with you. So my heart is not broken, but I am currently moving all of those standards into Power School, and it is a lot of work. But the work is good and the work is done, so I'm proud of that piece of it. So yes, I'm disappointed that we didn't get the transcript and the reports were clunky, but the process was well worth it, if that makes any sense at all.
And one of the things we're working at the elementary level, because it is a good reporting tool for that, we're creating some SOPs around reporting where we're going to be asking each teacher to make comments on each class so that we have comments always to support the scores that are in there. I think we've relaxed a little bit from that, and sometimes we're just looking at numbers going, what's that? At the elementary level, we're going to have to communicate what those numbers mean, so that's being established as well.
So we're gonna keep Empower. If we're only using it for a part of the school, is it costing us less, or we're still?
It's costing less. Yeah, you use it by number of students. And Power School is something where we don't have an additional cost because we had it anyway.
Yeah.
So we're actually saving.
That's always good.
Some of the updates and notifications I wanted to make you know to make you aware about. We've covered it already tonight. The US CDC is now the guiding document for the Department of Education. That's something that they moved from. I wanted to make you aware that Dr. Fern Desjardins is the board chair of the State Board of Education now. So somebody local is now on that state board. And the DOE is committed to hosting a 9:00 a.m. Monday session with all superintendents. Giselle and I attended again this morning. We got some more information. So they're committing to every week, 9 a.m., all superintendents. It's wonderful. It's a good support. So it's question and answer, and all the questions that, that superintendents have throughout the state. I also wanted to let you know that we had our administrative retreat last week. Our administrators got together. We spent an entire day talking around this return to school plan, and each school will be setting a goal. It's one of the directives that I have for them, a school-wide goal that they're going to be implementing. As soon as our two schools implement their goals, we're going to take it to you and show you what the school's goals are for this year. We also have some curriculum leadership goals. The curriculum leadership goals are specific to the RTI process.
RTI district-wide, Hattie, visible learning, some school-wide goals, elementary, and then the middle high school is making their scope and sequence and their syllabus available with details, and that will be uploaded to the website so people can see what is going on in the classroom, but more granular than what Unit 1.
And then elementary is the reporting SOPs. And
the reporting SOPs for Empower.
So a lot of goal setting that we're going to share with you as soon as those have solidified. Also, we have a new teacher orientation tomorrow. All of our new teachers will be meeting at the Tech Center, and we have a full day plan trying to show them support. In addition to that, we've committed, Sharon, Peter, and myself, to have monthly sessions, breakout sessions with our new teachers. We want to meet with them monthly to see how they're doing. Are they surviving? Do they want to quit? How can we get them not to quit? We've made a monthly commitment to do that. We're going to do elementary separate from middle high school. So every month we're meeting with these new teachers and trying to support them. Because as you know, we need to hold on to the teachers we're getting, because they're not coming out a lot. Moving on to item D, ESSER ARP was released earlier this month. We've asked the administrators to start prioritizing projects. I put out a survey to the community about what their thoughts are about this money and what they think priorities should be. And I organized the survey the same way that the state prioritized it. Half of the section is on learning loss. The other half is on other COVID restrictions and how to improve. And we'll take all that data, put it together, prioritize, and then come to you with some suggestions. Our allocation is $1.8 million, and that's a lot of money, but we can stretch that out until September 30, 2024. The only things we've committed to that so far is our instructional coach at the elementary school for this upcoming school year, and our interventionist here at this building for the upcoming school year, and then the summer school remediation projects. So we've tied up a little bit of that money, but there's still a big chunk of it that we're going to have to decide. Do we continue these coaching and intervention jobs into year 2, 3, 4? Do we have more remediation projects? Do we do some construction projects? These are all things that we have to decide. It's a good segue into the subcategory here for priority projects. As you know, I've taken some ideas to you about a bubble gym project in the past. I've suggested that as something that maybe we can do. I think it was Toby that mentioned, it'd be nice to compare that to brick and mortar, to improve our facilities. So we've been looking at two kind of parallel projects. One is to move forward with a bubble type project. We're estimating that to be anywhere from $750,000 to $900,000 when everything is said and done. You're talking about your bubble, your foundation, your electrical, your equipment, your flooring, everything. When that's all said and done, probably. I'm giving a generous quote here, but the way things are prices are increasing for everything, I think it's fair to say that that's a good range. We've also at the same time looked at the small gym space and thought about what if we turn this small gym into another gym the same size as Fort Kent Elementary School gym currently is. The elementary gym is, I think Peter said it's a 55 by 55 is the measurement there. The small gym is 45 feet wide, and it's only about 45 long as well. 35 feet long as well. So we'd be essentially looking at doubling the length of the space, putting an additional pad of cement, busting down the back wall and going into the back parking lot, which would essentially, section off your back parking lot into a parking area and a playground area. We'd also have to expand about 10 feet wide, and there is an office there and a bathroom, and there's a janitor closet that you could actually expand 10 feet wide that way. The big kicker is the height of the roof is not high enough right now. Is Robbie here? It's what right now, 12 feet high, and we need to go 17. It's 12 feet high to the rafters, and our current cafeteria is 17. So I shot an email to Scott Brown at the department, because he is an architect, and I said, hey, before we get this engineered, which would cost us a lot of money to figure out exactly the cost, can you give me a ballpark of, and I shared with him the entire project, and he said you could ballpark that anywhere between $1.5 and $2 million for that entire project. So I guess what we're trying to gain from the board is should we even be proceeding with any of this? should we say that, well, 1.5 to $2 million, that's way out of our allocation for what we've been given in this ESSER ARP. Maybe go with the bubble idea, but even with the bubble idea, you're eating up a big chunk of money for one solution to our district. It's a big solution to a big problem, but are we willing to invest that money? That being said, I will mention on the next agenda item, which is totally related, there is another round of school renovation funding that's been put out. And if you look at the priorities, in priority 2, building structures is a priority 2. So there is a chance that we could apply for a school renovating funding loan for something like this and have it approved through that. There would be a local cost though if that would be approved. That's all food for thought.
I have a question.
Yes.
So for those of us that are new, what is the problem?
The problem is our elementary school does not have a gymnasium. It has a cafeteria
Okay.
that is used as a gym when kids are not in there eating. When kids are in there eating, and for the purpose of understanding, your lunches right now start at
11 to 1.
11 to 1. So you're
Okay.
you're maximizing that. So when Mr. Delisle has phys ed classes that need to happen between 11 and 1, he has to use the small gym, which is that industrial arts area. That's not a gym, but we call it the small gym. So we felt like a big need for that building is to have a gym
Okay.
separate from the cafeteria.
So if you were to go forward with the bubble, where would the bubble go?
The bubble would go in the back parking lot as well, extending out from where C Wing to the back is and going towards the soccer field.
Okay.
The problem with the bubble is it's a separate structure. So
Right.
you've got to go outside to get into the bubble. You cannot connect the bubble to the school
Okay.
unless you sprinkle the whole school, which, right, you can't.
My third question. Seeing as how we now need to find funds for the pool testing coordinator, is that something that can come out of?
If pool testing coordinator will have to come out of this funding as well. I don't believe that we need to hire a full-time nurse to do this. I think we can contract a service.
Okay.
We need to do a little more research, but my idea was to contract nursing services for 10 to 15 hours a week.
Ben, who was doing UMFK's poll testing last year
They were, yeah.
internally?
Yeah, I think
Yeah.
I used to go spit in a little jar every
Yeah.
couple days.
Was it a UMFK employee?
Yeah, it was just the work study students.
Work
that
study
went to uni.
kids.
Just-
Yeah.
It's too bad we couldn't tap into that, because that was a pretty slick program they had over there.
Yeah.
Because they had your,
Quick and efficient.
the barcode, they knew who you were.
Yeah.
There you go.
And it really didn't take long either. Like, I'd walk from my car and just not swallow my spit and then be done.
You could save easily a minute by not swallowing before you left the car, yes.
I wasn't so thought out about the process.
I'm with her. Like, I'd save it up for Market Street.
Because it's awkward to be standing there just like.
You don't want to wait long.
What's the lifespan of the bubble? I think you told us before. but-
Peter's gone. I believe they said 12 to 15 years in this climate is the expectancy of the fabric on the dome, and the replacement cost. Ooh, don't quote me. The replacement cost. I think we figured the replacement cost was going to be somewhere between $40,000 and $50,000 based on what they said is the average cost. If you're going to re-roof a building, you're looking at
Well,
upwards of that as
What about a not exactly attached structure, but somewhat removed from the main building with something connecting the two together?
The minute you connect,
Oh, it's going to be all brick and mortar, right?
yeah, it's the fire marshal's
Yeah.
purview to. You can roof it. You can put like something to cover, people going back and forth like a
Oh.
canopy.
Yeah.
But you can't make it a permanent structure.
But you can expand, you can knock down that wall and expand or.
You can expand your current gym because it's 50% or less
Right.
of that existing structure.
Food for thought, your school revolving loan, the last one you had, which is the vestibule that is still being worked on, your share was 37% of the cost. The current ED 279 lists your share at 31.6, so, and that's usually over 5 years, no interest paid.
So let's say it's a $2 million project, we would be on the hook for 31% of that $2 million project.
I also probably should have asked this the first 10 times I heard it, but what is the vestibule?
You've heard it less often
If
than you
there's
walk through it.
well, if there's someone that knows, I mean, I've been
It's-
sitting here wondering.
It's the
Entryway
entry to
separator.
a school, and what we're doing is building a wall. It creates a space so when people come in that you don't know, or you keep them secluded in an area until they say where they're going, they sign in, so you have a
Also, like
safety.
wall grass.
So like
Yes.
if you look at what they
Like, I
did
don't know
here,
if
Abby,
that's how it's-
what they did here to the entrance,
Okay.
now you have that separate set of doors. Those are gonna be shut when school starts.
Okay.
And you're gonna have to get buzzed in order to pass to get into the school.
Thank you.
Yeah.
You good?
I'm good now.
You good?
Oh, Robbie's not.
I just want to say that whether it's a bubble gym, or whether it's in addition to the small gym, there's a huge community benefit to having that extra space, whether it's for basketball practices from high schools, whether it's the rec department, indoor soccer, those types of things, events. There's a huge benefit to that, not just for the school, but for the community.
I know that Peter Sose feels much more comfortable with brick.
Mm.
He doesn't feel that confident in a bubble because you don't see a whole lot of them around here. So he's just kind of leery to that. So I will offer that as well.
I think,
When I
yeah.
compare my
Yeah.
house to those little pop tents,
Yeah, Robbie makes a great point. I mean, the Fort Kent Rec Department makes great use of the elementary school gym, especially during the winter months with the basketball program and whatever else. And by having that additional gym space, they could potentially run multiple programs at the same time. Or we could have our own while they're doing theirs as well.
could we
The
talk
plan
about
is to keep the cafeteria space to be able to be used as a gym as well.
Okay.
More of an
Yeah.
after-school sense where we
Sure.
can use it as a cap during the day, have the gym for phys ed and those things during the school day, but it's still gonna be available after.
like stage space built in there? Something we need to do. We don't have any real performing space within the elementary school.
Right? If and when we decide to have it engineered, we can have that as an option.
Yeah. Because I think, I mean, we're very cognizant of sports, but there's other activities, and I think we sometimes forget them.
So when would you know in the school funding?
We would have to apply. When's the due date for renovating?
I believe it's in October, but there's a lot of steps to get there, and then that process is kind of long. You apply to the state, you give your reasons, state approves, then you have to apply to Maine Bond Bank. They approve, and then you're given a timeline to complete the project. The problem is gonna be like what we have right now, is getting contractors to commit to that time frame. There just aren't too many.
One thing we cannot do is we have to, not that we cannot do it, we have to be careful of trying to double dip. So funded a little bit with ESSER, funded a little bit with renovating loan. We almost ran into a problem with this project, but we were able to show that our renovating loan was approved before COVID, and because of COVID, we had overages, which was our saving grace. So we were allowed to pay the balance with ESSER 2. This time, COVID's already existing, so they won't let us apply for a little bit from this pot and a little bit from this pot. What say you? What should we do, you think?
So the renovation funding, you're saying our portion that we have to pay back is 31%?
Right now, because your school funding rate is at 68.36, your local rate is 31.64. That's SAD 27.
Okay, and so on $2 million, it's $620,000.
Paid out over 5 years.
Paid out over 5 years.
There might be an option to pay it out over 10 years. When we did the air exchange, it was $1 million project for each school, and we were able to pay it out over 10 years instead of 5 years.
That would be much nicer.
I think we've been talking about this retreat for a while. I think once we have an idea of where we want to go, it would make sense to know that we've got this to work with, and maybe get an idea of where we're looking to go as a district, as a community. And what do you guys think?
Well, and obviously availability of funds
Yeah.
if they're not there, they're not there, and we're
What
not
we
gonna
do
fully
with them.
finance this structure.
Yeah, but I mean, what we do in general, I mean, because it's not just this you're asking about, it's generally, correct? I don't know.
I think you've heard your community say that they want their schools. If they want their schools, the schools are gonna have to not be just a building that you, because what happened in Frenchville can happen anywhere. I mean, it's not the same structure, and, you know, I'm not saying, I'm not trying to scare anyone, but if we don't invest in these buildings and make them grow and make them more of ours, I think we're not doing anything.
I agree. I mean, I think that's why, like, maybe we get a guiding spirit. Like, what are we planning on doing? Like, what's our goal for the next 10 years, 15 years? And we can use this money to move us there. I think. What do you think of that, Gary?
No, I would agree. Again
Again?
with you.
What?
Twice tonight.
Would it be too late to suggest maybe putting on the agenda or discussing a date for the retreat so we can all
We
sit
had
down
something
today?
on here to
Did we have?
discuss a variation.
What I had suggested is that, in my email to you, is that perhaps if we can't find a common date, and we just, the dates that I suggested to you, we were all over the place. Do we roll in a rotating agenda item that we dedicate, and I know tonight's meeting was an anomaly, but hopefully we don't have 3-hour meetings every time, but if we dedicate 20 minutes per meeting to just talk about goal setting and planning and strategic planning, maybe that's the right way to go. Or if we can come up with,
I think if we do a board retreat as a kickoff,
Yeah.
and then from there, because, I mean, some of us can get real long-winded on a particular subject,
Yeah.
depending on what it is that, you know, we're
so I can
inspired
continue
about.
to offer dates and then see if something lines up.
But let's see if we can, like,
Or unless
let's
you
try to nail a date down tonight.
Let's do it.
I'd like to try that. Everyone's okay
At
with
this very moment.
that? Right now.
Right now?
Okay.
Go.
I think if we get it in there before.
I can pretty much
Horribly.
Before bird season.
anytime, as long as I
Let's
know
do it for bird season.
Here's a fun fact, the existing revolving renovation payment that we have,
No, what
Air
we're
exchange?
suggesting is we
the last payment on that 10th year is in the 23-24 school year, and that's about $69,000. So if you were looking at a revolving renovation fund, and we were approved and everything coming into play, 24-25 would be a really good time to start a new project.
What year was that, I'm sorry?
24-25. Our last payment is in the 2023-24, and it's about, it's $69,000. It's almost $70,000. That if you were to roll it into a different project,
I'm also concerned about the impact that has on our supply of the hot water from the biomass all the way over there into another structure, if that's just minimal impact or negligible, I should say.
it would have to be engines.
Yeah.
Yeah,
That's an easy solution to fix.
for the boilers.
All you gotta do is upgrade your heat exchanger.
Okay.
We have the bigger heat exchanger here. Grammar School has a smaller one. If they're gonna build the extra building, all we have to do is upgrade that heat exchanger, and that's not a big piece of equipment.
Now, this extra facility, could it potentially be used for a high school game? Or, I don't know what, you know, are there times where this gym is tied up, and if we had the additional space, we can't really use university, but
Yeah, we would have to make sure the specs are to whatever the MPA specs are. We weren't originally thinking that, but if we expand a little more, we.
I'm just thinking that's added value to that sort of structure, and that goes a long ways to the community, right? If we're able to use it for the rec department as well as high school sports program.
Yeah, well, if you take it, this summer, they ran a basketball tournament, and UMFK was not available, so the second site had to be at Wisdom. And we
Sure.
would have had 2 gyms here, we could have done it right here.
Indoor soccer.
Yep.
I think his direction on the gym, I would be more in favor of something solid. Like Toby said, you know, have a stage area. It'd be a much better investment. I think
Public gives me the willies.
Yeah.
you could sell it to the community.
Gary, I don't think we need a formal
No,
motion
No,
or
no,
anything.
you
Gives me
just-
direction.
Okay. Great.
Do we wanna try to?
I could date.
Yeah, let's pick a
Yeah,
date.
let's,
Yeah.
Let's get it done.
September's a good month.
Hey, we've already gone 3 hours, let's just keep going, right?
Yep.
My
Already brought
first
the
board
vegetables.
meeting
This is
lasted
par for the
till almost
course.
11 o'clock, so.
Let's start with easy question. Weekday or weekend?
I'll do either. It costs me less to do weekend.
Me too.
Well, what about a, after work meeting, dare I say, 5 to
Well,
5 on?
we're here 6 to 9 anyway, right?
Right.
We're not even halfway.
But if we do a supper, 5 to,
Yeah.
5 to 7, 5 to 8.
That would be okay. Yeah.
On a weekend?
No, no,
Weekday.
during the weekday.
Can we be late?
Yes.
5:05.
6 o'clock?
We can start at 6.
I have to get approval from my wife first.
Yeah. See, that's the problem I have with weekends. I'd have to get approval from my wife first.
6 would be easier.
Okay.
It really would for me, I mean, then I could at least see my wife and daughter for about 3 minutes.
Yep, so let's do a
Okay.
6 to 8 or 6 to 9.
Yep.
Let's go with 8:30.
Oh, I like it.
6 to 8:30.
That's shooting for the middle. Assuming that's the right answer.
When?
You probably have the most meetings of anybody at this table.
Why don't you throw some dates
Well,
at
you know
us?
what? Our board meetings are always Mondays, so any other day of the week is more flexible than Mondays.
Wednesday the 1st.
What first is that?
September?
That week or just that day?
That week.
Okay.
Following week would probably be.
Yes.
Wednesday the 8th.
Yep.
I'm okay.
New kids?
Yeah, I should be okay.
You're new.
I'm changing jobs, so.
Don't tell anybody.
Wednesday the 8th?
Wednesday the 8th.
Yep.
I will send a calendar invite for you.
What time?
Wow.
There, look at that.
So
We just
exciting.
agreed.
In like 3 minutes.
That's so I can remember. Wasn't for
I
you.
do that all the time. I send my sister or Josh random dates.
What's next?
So what we'll do for the purpose of ESSER ARP is, I don't think we'll target a structure in ESSER ARP. Instead, we'll try to stretch out that money for 4 years with interventions and positions and whatever else we have for needs. And we'll look at the school renovating funding to try to be the funding source.
We're halfway down.
Yes.
Yes?
Are we looking to put any money in this building as far as maintenance and use all the plumbing and using it?
The uses of this money has to be specific to COVID. So we'll talk, even with the renovating loan, we can talk about what flexibility we have. But the funding is there.
Because that's on priority number 2, right? Water?
Yep.
Water system?
Yep. Wanted to let you know that we have assisted MSAD 33 with their fire. We sent a crew of workers. The original intent was to send 1 crew all on Monday, August 2. It was too much of a big crew, so they sent half of a crew on Monday the 2nd, sent the other crew on Thursday the 5th, and it's amazing what work was done in those 2 days. There was a lot to do in a short amount of time. And as of today, I believe all of those classrooms that we moved stuff out have been painted, and teachers are now moving in. So thanks for allowing our workers to do that. They really enjoyed themselves. They were fed both days, and it was really nice to see what was happening. You can expect a letter from 33 coming shortly thanking you all for allowing that, because their crew would not have been able to do it themselves. We have done that, and we also, we're looking to loan some unused technology just in time for them to get their new stuff ordered and in on time, older iPads and stuff. It's all on loan, it's all been inventoried, we're gonna get it back, but we just wanna make sure that 33 had some technology first, just because Madawaska had more abundance, and if they needed some that wasn't satisfied from Madawaska, they were gonna come here and borrow some furniture. Again, that's all being borrowed because they're all getting everything replaced as part of their insurance. I wanted to let you know of the administrator report schedule. You did not get administrator reports this time because I didn't want to ask that of the principals as they're trying to prepare for next week's start date. But they will be starting on your September meeting, and so that's the schedule right there of who will be reporting and when, so you can expect those. That's all I have for superintendent.
Move on to committee reports. Policy committee.
So I did share with you two policies. One of them is policy BED, and policy BED is essentially a policy that will allow you all to participate in remote meetings if ever you need to have them. Because the executive order has been lifted, we can no longer have Zoom meetings unless we have a policy in place that allows us to do so. Policy BED, do you have that in your packet?
No.
Me either. Policy BED, you know what, let's table it because you don't have it for first read. I apologize that I didn't read that.
Want to make a motion to table those?
We can go with the second one because I do
Okay.
believe child find is in your packet.
Yep. Yes.
Is that a motion to table BED?
Yes.
I'll second.
Any discussion? All those in favor?
Child find, because the new law allows special education students to attend school until age 22, we would have to update our child find to reflect that. So you can see the one change in that first opening sentence, strike through the school year until they turn 20 and change that with until a day in which the child reaches age 22. I find it's funny that this is child reaches age 22, but that's what the recommendation is. This is just a first read, so we'll get back to it next time. The second committee report is negotiations, and I would recommend that we move that to the end of the meeting because it requires an executive session.
Second.
All those in favor?
I did.
Sarah and Keith. Items for information for new business, we do have a resignation of an Ed Tech 3 at Fort Penn Elementary School. Elaine Emo has submitted her resignation. She accepted a teaching position at MSAD. The recommendation is to accept Elaine Emo's resignation.
Motion to accept.
Second.
Any discussion? All those in favor?
We also had a resignation of Tamar Philbrook. She submitted her resignation and will not be able to coach soccer this year, and that's for middle school girls soccer.
So moved.
Any discussion? All those in favor? Unanimous.
We do have new hires, and I would recommend that we also go into an executive session at the end of the meeting to discuss those as well.
So moved. Second.
Discussion? All those in favor? Unanimous.
Current openings, we do have the Fort Kent Elementary at Tech 3 to replace Elaine, and that is the only current opening we have. I did provide you just so that you have an idea of what has gone on in SAD 27 since last school year. It's a lot of movement between transfers and resignations and new hires. So just so you know, the staff has been working really hard. We're glad that the dust is settling. So that's just an FYI for you.
Yeah, this is crazy.
It's the most we've ever seen, and it's just the nature of, when you have an opening, then you have to fill in house first, and then that creates a ripple effect, and everyone.
We're not blaming this on COVID, right?
No, this is
Natural.
This is natural stuff.
We do have our MSAD 27 officers and standing committees for this school year that we need to consider. I did provide you with last year's officers and standing committees. There is one standing committee for sure that will need to be addressed, as Barry Willett is still on the finance committee.
Anyone interested in being on the finance committee?
I think first, Mr. Chairman, we'll have to agree on a chairman and a vice chair and a treasurer for our officers.
So, I know in the past, we had a strange, I don't know how I want to word this, but strange arrangement where we had one individual who was like the point person, and if you wanted to be the chair or vice chair, and kind of, I think it was you.
It was me. We did away with that last year.
We did, that's what I thought.
We decided that we were
Before
gonna.
there was two of them.
We just decided we were gonna have no.
I really understood how that all worked.
It was the Joel cause, I think.
Yeah, Kingmaker.
There was nothing really in there.
Yeah, Joe was the Kingmaker.
That sounds right. Last year, you guys would decide to do away with that process.
How do you guys feel about, because it's late, it's 9 o'clock, can we do this next time?
Yeah.
Are we gonna make it? Is it that, I mean, before I put it to motions, everyone okay with that? I'll put it to motion. I move to table this particular thing until the next meeting.
Do we,
Second.
do we need somebody on the finance committee before the next meeting? Okay.
Yes.
Take any of the committee and be on.
Further discussion? All those in favor?
Yeah.
We do have a presentation here under this item as well that Mr. Karen is prepared to give. Do you want us to proceed?
I would recommend that you not do that at 9 o'clock in the evening. Just
send us the PowerPoint.
There's enough detail in there, and there should be some good questions. That's probably not going to happen now.
Can we share it over the electronically?
Yep. We share it out, yes, in a PDF format, and it's probably something that we can visit briefly at the retreat. It would make sense because it is about strategizing a less traditional approach to high school studies in significant part moving forward. So I think it would fit into that.
I would like to make a motion for people, or for Peter to send us the PDF.
Second.
Discussion? All those in favor? Toby.
Toby or
I want
Second.
Toby's quicker on the draw. Sorry, just go right that way, right?
You don't want to read this?
So I think the next motion would be to enter into executive session pursuant to 1 MRS 40560 to discuss labor contract negotiations with the Northern Heuristic Teachers Association and the Teamsters Local 240.
So moved.
Second.
Discussion? All those in favor?